Before I commence, may I request everyone to switch their phones to silent mode and please rise for the national anthem. I request the photographers to refrain from clicking pictures during the national anthem. Jana Gana Mana Adhinayak Jaya He Bharat Bhagya Vidhata Punjab Sindh Gujarat Maratha Dravida Utkala Banga Vindhya Himachal Yamuna Ganga Uchala Jaladhi Taranga तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 Namaste. On behalf of Flow Hyderabad Chairperson Pratibha Kunda and her committee, I, Rashi Agarwal, Executive Secretary of Flow Hyderabad, extend a very warm welcome to the esteemed doctors who have made this session possible, our distinguished past chairs, and our fellow Flow members. A few weeks ago, after my morning workout one day, my friends and I were chatting, and I asked them a simple question: what does health mean to you? One said, not falling sick. Another said, being fit. And then one of them smiled and said, health is when my mind, my body, and my emotions finally stop arguing with each other. Now, if that doesn't hit home, think about this: skipping breakfast, surviving on caffeine, counting the 10,000 steps, and balancing our 8 hours of sleep. We've all been guilty. That's exactly why today isn't just another event. This conclave is a gentle wake-up call, a space to explore a 360 degrees awareness of our minds, bodies, and souls. Because real health isn't just about fitness, it's about harmony. Welcome to the Health Conclave. I request Flow Hyderabad Chairperson Pratibha Kunda, Dr. Nageshwar Reddy, Dr. G.V. Rao, Dr. Ruma Sinha, and Dr. Srinivas Kishore, Flow past chairs Ms. Usha Rani Mane and Ms. Shubhra Maheshwari, Y-Flow Chairperson Pallavi Jain to please step forward for lamp lighting. I request the Flow Core Committee to please step forward for a picture after this. I now request the chairperson to felicitate all our esteemed doctors. Dr. Nageshwar Reddy, please, sir. Dr. G.V. Rao. Dr. Srinivas Kishore. Dr. Ruma Sinha. I now welcome the chairperson to deliver her welcome address.
Hello and good afternoon to everyone. It's my pleasure to welcome each of you to this Flow Hyderabad Health Conclave. Distinguished speakers and my fellow Flow members, your presence enriches this dialogue and makes this session even more special. Before we begin, some stark facts. Did you know 1 in 5 adults in India suffers from gastrointestinal disorders? Yet, many don't know that early care can make all the difference. I'm sure our doctors will put more light on it. 1 in 3 women over 50 faces osteoporosis, often undiagnosed, silently affecting their strength and mobility. Breast, ovarian, and cervical cancers account for nearly 27% of cancers among Indian women. Early detection and preventive care can be life-saving. Over 40% of adults struggle with sleep disturbances. I don't know how many calls we keep doing to Mr. Srinivas Kishore on this, especially women juggling careers, families, and hormonal changes. Sleep isn't a luxury, it's a foundation for well-being. Wellness is multidimensional, and Wellness 360 means looking at health from every angle, from gut to sleep, from women's health to cancer care, and from preventive insights to cutting-edge innovation. Think of it as your full spectrum health GPS, guiding, informing, and empowering you to every aspect of life. The saying goes, health is wealth, but I think of it more like a bank balance of energy. You spend a little on stress, withdraw a little more on deadlines, and then suddenly one day the account is overdrawn. This reminds me of something that happened a few months ago. I went in for what I thought a quick routine health checkup, and I thought in 30 minutes I'll be out of this place. And fast forward 3 hours, my quick checkup turned out to be an audit of my body. My doctors tell me that I was dehydrated, low on vitamin D, vitamin B12, and apparently showing signs of a brand new syndrome called type A multitasking. When I asked if that was even real, the doctor laughed and said, in women who are constantly juggling work, family, deadlines, and a million little things in between, it might as well be. That's when it struck me, wellness isn't a one-time appointment, it's an everyday relationship with ourselves. So today, Wellness 360 is all about real conversations about health, hormones, habits, and happiness. It's all about understanding wellness as a whole, not just in parts, and learning from some of the most brilliant minds in healthcare. It is my honor to introduce our panel of experts, Dr. D. Nageshwari Reddy Garu, Chairman and Chief of Gastroenterology, AIG Hospitals, Mr. G.V. Rao, Chief of Surgical Gastroenterology and Minimally Invasive Surgery, Dr. Ruma Sinha, Senior Consultant Gynecologist, Laparoscopic and Robotic Surgeon, Apollo Hospitals, and President of Asian Society of Gynecologic Robotic Surgery. And Dr. T. Subramaniam, I welcome him, he just came in, Medical Director and Surgical Oncologist, Indo-American Cancer Hospital. And Dr. Srinivas Kishore, Director and Head, Department of ENT Surgeon, Sleep Specialist at AIG. Each of these speakers brings unmatched expertise and passion for advancing health in India. Today is a rare opportunity to gain insights directly from leaders shaping the future of health in India. I encourage you to engage actively, ask questions, and take away actionable knowledge you can apply in your own lives and communities. Before we dive deep into these discussions, I have an exciting news. We have Health Coverage. It's an online, you have a QR code outside where you can just scan and it gives you, it's an AI probe. I think Dr. Ruma Sinha has worked a lot on it, which tells you what kind of tests you have to do for your body, what is required, which is launched this year under our national initiative. So let's get ready to explore Wellness 360. As we embrace this journey, remember, health isn't just the absence of illness, it's thriving in every dimension of life. True health is what when body, mind, and spirit are all in balance. That's the power of 360-degree wellness. With that spirit of balance and curiosity, let's welcome our first speaker, Dr. D. Nageshwar Reddy Garu, to take us on a journey into this incredible world of health. Welcome, sir.
Thank you very much. I'd like to thank the FICCI Flow for giving us this opportunity at the AIG hospitals to host this meeting. I'm a gastroenterologist, but I'm not going to talk about gastroenterology. Like already you told us about how 1 in 5 Indians suffer from gastro. Actually, it's 1 in 3. 30 to 40% of Indians have gastrointestinal problems, but I won't talk about that because we are already busy in our clinics to seeing all the patients. What I'm going to talk about is something that is startling. What I'm going to talk about something which is very new, which new for you, but even new for doctors. The realization that our health depends not on our heart, not on our lungs, not on the kidneys, not on the liver as we thought, but on the gut. And let me show you evidence for all of this, what is happening. This is extremely new information. And some of this information is still in only medical journals, not in medical textbooks. I'll start with this. I don't know how many of you are aware of this. This is a CGM, it's called continuous glucose monitoring. So if you want to monitor what happens to your glucose, normally we take your blood sugar level, see what is the blood sugar, fasting, postprandial and so on. This is not normally is done, but that is not physiological. All of us are not having blood sugar once or twice. Our blood sugar in the body is continuously running in the blood. So we want to know what is happening. And for that, what we do as doctors is very common, and some of you must have used this. You put a small patch here on your arm, and then continuously shows what is happening to your blood sugar every second, every minute, and so on. So what we did was actually this is my glucose response. So when I took a normal meal to look at what happens to the blood sugar, you see my blood sugar before the meal is very low. It's about 190. But as soon as I take a meal, my blood sugar, the standard South Indian meal blood sugar went up to about 150, 120. And then about 2 hours time it came down again. This was the normal response. So I said, okay, I know what I eat and what's happening. Let me eat something different. Now, why this was happening is as soon as I eat food, the insulin is secreted in the body from the pancreas. The insulin shifts the blood sugar into all the organs which requires the sugar, the brain, the liver, the kidneys and so on, and the sugar levels comes down. And then about 2.5 hours later, I feel a little hungry, wanting to start the next meal. This is a normal phenomenon which occurs in everybody. This was my sugar chart. Now, when I took sweets, Diwali is coming, everybody is eating sweets. I wanted to see what happens. So I took a plate of sweets, and so what happens is this. Suddenly my blood sugar shot to very high levels, went up to 200, and then suddenly dropped down. It didn't come down gradually as it happened with a regular meal. So it is very abnormal. Went up high and then suddenly dropped. Then what I did is I said I'll take a healthy meal and see what happens. So I took some fruits, vegetables and all and see what happens. My blood sugar never went very high, went only to about 100 and kept at the same level for a long time. So I didn't get hunger pangs. So this is why people say eat healthy food, this is what you should eat, your dietitians, you're reading in the papers what all you should eat and all. Now why is this blood sugar response so important? It's so important because they have now shown that your disease pattern will depend upon how individually each one of you respond to blood sugar. Each one of you has very variable response. So whether you gain weight, whether you have increased lipids, increased dementia, increased cardiac disease, increased diabetics, everything depends upon our body's response to what we eat, how the sugar goes up. In some people, even if you eat a lot of food, doesn't go up, so the response is different. So to see why this response in different people, I have friends who are eating very well, they are eating all sweets, everything, they don't put on weight. Now, even if I smell sweets, I put on weight. So there is some difference. So what this difference is there? So we thought we should look at this, what happens. So look at this experiments we did. So this were about 400 participants. Actually, there were totally 1,000, but I separate them into two groups. So 400 participants. They were given cookies. And when they were given cookies, the blood sugar went up to 115 and then came down. We then gave them something healthy, that is bananas. And we gave them bananas. See, the sugar doesn't go up. We know this. Vegetables, fruits and all are good. Sugar doesn't go up and stays like that. So this is what we expect everybody. That's why your dietitian says, eat vegetables, don't eat cookies, don't eat sweets and so on. This is standard. But what was most surprising is this. When we looked at other 500 people, and the first group again, we gave them banana, look what happens. It's acting like cookies for them. And we gave them cookies acting like banana. So all this advice which the dietitians tell you is wrong. Because each body has an individual response. So I was very excited with this. I put the patch again and saw. I found that if I eat, for example, chapati, my blood sugar goes like anything. But if I eat a brownie, nothing is happening. So now I know I can eat brownies, it's safe. So this is a response that we can test in everybody. So why is this that's so different? Everyone is different. The reason they are different is because of genetic reasons. We know that each of us, like even in our families, we'll find that some people in a group of family are eating well, nothing happens. Some people are, not eating, they still bloat, put on weight. So there is something genetic in that. We know that, I think Srinivas is going to talk about sleep and other things. They all of them, and diet we are told important. But what we have found is the most important factor is not all this. The most important factor is this, the gut microbiome. The gut microbiome is what determines what actually happens in your body. So what I'm going to do to you in next maybe 12-15 minutes is tell you about this gut microbiome and what is the huge amount of knowledge that has come in recent years. And this is the one that has attracted attention of scientists all over the world. And a lot of new data is coming on this. So this is very interesting. So this is important because our gut is full of microbes, and it's foolish for us to think that when we eat food, the body decides what to absorb, It's the microbiome which decides what happens to the food that you eat and so on. I didn't know about the important. I'm a gastroenterologist. I'm practicing for many years. I'm supposed to be on top of my field. But till 5 years back, I didn't know about this gut microbiome. The way I came to know about is this. In fact, this was a friend of mine who was a vegetarian, non-alcoholic, total teetotaler, who went to one of the parties on the New Year Eve a few years back. And when you come back from a party in the middle of the night, the police test you for alcohol, right? So they tested him on the road, and then they found his alcohol content was very high. And the police are very strict. They took him off to put him into jail, and they have a lot of problems with that when that happens. But poor fellow never drank any alcohol, and then he rang me up. So I said, "Are you sure?" He said, "No, I don't drink alcohol at all." So I said, "There's something wrong with this." I rang up to the DGP of police, who was at that time a friend of mine. The DGP said, "Are you sure that he doesn't?" I said, "I'm sure." Then he got several meters to test. All the meters were showing high alcohol. So he said, "Look, I'm sorry, this is all showing we can't do anything. We're very strict about this. Even if it happened to the Chief Minister, the same problem in Laka, he has to be in the jail." So this is when, but I'm sure that he didn't take alcohol. This is when I got a little worried. What is happening? How can somebody who has not taken alcohol have alcohol in the body? Then I went through, I sat down in the night, went through the Google, and then I came across what this is known as auto brewery syndrome. There are in some people a certain type of bacteria called Klebsiella. If there are a lot of it in the gut, it actually manufactures alcohol from the food you take. So you have a brewery in your body. So poor guy had a lot of this Klebsiella, and he had a high carbohydrate diet. The carbohydrate got converted into alcohol in his breath. So I had to take all these books and all and show it to the police to get him out. Even then they didn't believe, but they had literature. I said I'll otherwise go to the court. So they left him out. And then that's when I realized the importance of bacteria in our body. It can do so many things, you know. So of course he was, I don't know, fortunate or unfortunate, because for him, he doesn't have to go to a bar. Every time he has a good meal, you know, he'll get this effect of alcohol. So I realized that this gut bacteria, and that's how we started getting interested in this. So we started doing a lot of studies. We established in our hospital one of the largest microbiome lab in the world. We are fortunate that a Nobel Prize winner, Barry Marshall, decided to join our faculty to do research in this area. Since then, he's been involved. He's the one who discovered this bacteria called Helicobacter pylori, and he got the Nobel Prize in 2005 for this. So he started helping us, and we set up this huge laboratory where we can study the microbiome and what happens in the gut. And this is just a few synapses of few of the things that we found, that in our body, right from your mouth, stomach, small intestine, large intestine, it's full of bacteria. The concentration varies. The only part which is partly sterile is stomach, and stomach has only Helicobacter pylori. Everything else is full of bacteria. So much bacteria that it's surprising that there are human body, there are 30 trillion cells in the human body, human cells. But there are 39 trillion microbial cells. That is, there are more bacteria in our body than human cells. Which means, in fact, we are more bacteria than human. Human genes are 20,000. Normally, if you look at the genes in a body, it's 20,000. But bacterial genes in our body are 2 million. Which means that only 1% of us is human being. 99% is bacteria. Now, this happened in evolution. What happened is that as we, animals from sea animals to as we grew, there's a symbiosis which developed between the bacteria and human being. All animals, every animal has got bacteria. And the most important thing is, if you clean the body or animal or a human being of all the bacteria, it's called germ-free animals. If you clean completely and create a germ-free animal, the animal dies immediately. It can't survive. If your body was cleaned of all the bacteria, you will die. You won't survive. Because it's so much dependent on it. It's a symbiotic reaction. And right from a very, very early age, right from our birth, we develop a certain bacteria. And this bacteria can, grows. There are 3 factors which actually determine what bacteria you have. Unfortunately, all three factors are very early in life. Whether it's a vaginal delivery or a cesarean delivery. If it's vaginal, healthy bacteria. If the mother feeds the child for 6 months after birth, healthy bacteria. But stops feeding early and gives this bottle feeds, then bad bacteria. And third most important thing is the presence of antibiotics. Unfortunately, all our children are given antibiotics for small things. Within 3 months, if we give antibiotics to the child, the bacteria become bad bacteria. So these 3 factors determine whether we have good or bad bacteria. And unfortunately, this is something that is not in our hands. It's already past us. So by the time we become a little adult, then bacteria have already established. Now, why is the reason that we didn't know about this bacteria? In fact, the reason why we didn't know about this bacterial population till 5 years is because we didn't have the ability to culture this bacteria. So normally when we study bacteria, we take them out, put them in what is called petri dishes and study them, how they grow. But we could never do this because in the gut, the bacteria were very deep inside, like a dark place which is anaerobic, no oxygen. So as soon as you get them out, they immediately die. But now we have developed technologies. We have actually over the last 5 years in our institute worked on this, where we can look at the genes, the proteins that this bacteria produce, the metabolites this bacteria produce, and doing all this, we have now have a complete knowledge that in the human being we have 1,000 species of bacteria. 1,000 different species of bacteria. If it becomes 800, then you become diseased. The more bacteria you have, better for us. And we have also classified into different bacteria, different types, the good and the bad. Predominantly, these are the good and bad bacteria fighting against each other. So in your gut right now, there is an army of bacteria, good and bad, fighting with each other. If the good ones win, your health is good. If the bad ones win, your health becomes bad. So this constant battle is going on in every one of you here, and you're not realizing it. There are many things that determine bacterial, what type of bacteria you have. I told you about these first 3 things that happen in life. The others, I'll discuss a little about diet and so on. You have to understand 2 terms. One is probiotics. What are probiotics and prebiotics? Probiotics are food which are good for the bacteria. So if you have food like yogurt, cheese, kimchi, they're all good for your bacteria. So you take a lot of these probiotics, you have healthy bacteria. So prebiotics are actually foods which actually create these bacteria, like apple and so on. So what do the good bacteria do in your body? The good bacteria, these are good bacteria, so they have a lot of functions, like they produce these short chain fatty acids. And short chain fatty acids, all the substances that they produce actually help us in immunity, putting the gut microbiome in the proper way. But more important is this, that the food what we eat gets converted by these bacteria into substances which go to our brain or to the heart and so on. For example, we are told eat almonds is good for you, but not good for everybody. Almonds are good if the bacteria is capable of converting your almonds into tryptophan, a chemical which goes into the brain, is good for your brain for energy and so on. So therefore, what all food you take is not the food you take. It is the food that is getting converted by bacteria into different substances which go to your brain, heart and so on. So this is a very important fact, remember, because if you take all the almonds, sacks of almonds every day, but if you have bad bacteria, it's not going to be helpful for you. So this is important. So there is now a big connection between the brain, the gut and the heart. So there are some people who develop dementia very early. Some people are very, very alert. 90 years of age, they are very alert. Now we are trying to see why this is there. And we find the main reason is not the brain, but it's the bacteria. The bacteria in your gut are keeping some people very alert, very intelligent and so on. Whereas unfortunately, if you lack those good bacteria, you can become dementic, dull at early age. So earlier on, when the Nobel Prize winners die, they should take the brain of the person to see why this chap is so intelligent, he got a Nobel Prize. And now they're thinking, let us examine the bacteria in his gut. So stool examination of the Nobel Prize winners are done to see if they have a special bacteria which is making them this intelligent. Similarly, heart. So we feel that some people heart attack because the vessels are getting blocked, but many times our cardiologists tell us that we have a heart attack, you do angiography, it's normal blood vessels. Nothing is there. And there are people who go to a gym, very young people who die suddenly, and their hearts are apparently good. The reason is because the bacteria produce a substance called TMAO. And if TMAO levels are high production from the bacteria, you develop cardiac problem. If they are low levels, even if you have other issues, the heart still functions normally. So the bacteria are controlling the heart. So now, when we are doing testing for people, in our general checkup, we do the level of TMAO because we know that determines the cardiac status. Very important. And this other very important thing is autism. A lot of newspaper news must have seen vaccination, autism, because some governments are against vaccination because vaccines are supposed to be producing autistic children. But autism is now linked to gut bacteria. It has been shown that if you take the gut bacteria of autistic child and give it to mice, the mice becomes autistic. So based on this, there are some very interesting treatments coming up for autistic children where they're giving a special type of intestinal microbiome to these autistic children. No medications are available, but this microbiome is actually curing these children. Especially the child is below the age of 5 years, is autistic. We now check the gut microbiome. In the stool, we take all the bacteria and we find if there's specific deficiency, we give this bacteria and the children are coming back to normal. So this is a phenomenal advance in medicine that has occurred. and we are starting to do research in this. This is very important. The other thing this bacteria do is they control your metabolism. Look at this very interesting thing. This is a germ-free mice. Germ-free mice have to be maintained very carefully. No bacteria in the gut at all. So we have a mouse lab now downstairs where the germ-free mice are in a big luxury. Air conditioning, sterile, everything has to be maintained very well for them. Now into this germ-free mice, if we introduce the bacteria from obese mice through the gut bacteria is given through the stool, these germ-free mice will become obese. But if you give lean mice bacteria, they become lean. So what is determining whether these mice become fat or lean is bacteria, not what they eat, not what their metabolism and so on. It's bacteria. And this has been confirmed in human studies. This was a case recently in US. I was also involved. Now this patient had actually ulcerative colitis, a very difficult disease to treat. So one of the treatment of ulcerative colitis is to give fecal microbiome, that is bacteria from the feces. Healthy people is given to this diseased person and the diseased person becomes alright. So this was done for this patient who did not respond to any treatment. And once healthy stool transplantation was done, this patient dramatically recovered, became alright, went home. But after 3 months she started putting on weight. She became very obese. So then she went to the registry of the donor who gave the stool sample for her in the hospital and found that this donor was very obese. And then she sued the hospital saying obesity is because of this stool donation, and she won the case. She won millions of dollars. So this is again a clear indication how bacteria transmitted obesity from one person to another person. So this is again very interesting. So can we change our bacteria? That's the important question. So we're talking all about, but can we make our bacteria healthy? Mediterranean diet is the one which is the healthiest diet in the world. People who eat Mediterranean diet in the Mediterranean regions, they live long, they have 90 years, they're very healthy and so on. And it has been shown very clearly that all over the world, the best diet is the Mediterranean diet. So if you take Mediterranean diet, if you change your diet today from the standard diet to Mediterranean diet, you become healthy. But unfortunately, it's very difficult to eat Mediterranean diet because this is what it is, extra virgin oil, all these things which you can't actually cook in an Indian way. For example, olive oil you use to cook your food, then the whole olive oil is destroyed. It can't be heated. It's only for. So there's certain difficulties. So what we did is we actually worked with a very famous nutrition institute in Israel and made this special Indo-Mediterranean diet. It's called Indo-Med diet. So we use the same ingredients that they use in Mediterranean region, but we made this like a special type of dosas, all that based upon these same ingredients. And we did an experiment. What we did is we took 40 doctors. Half of them were given this Mediterranean diet and half were given the regular diet. The rest of the activities were normal. And after 1 month, we found that those doctors who were taking the Mediterranean diet lost 3 kg. But more important was that their bacteria completely changed. They all had very good bacteria compared to people who had the standard diet. So this Mediterranean diet in 1 month's time was able to completely convert the bacteria. So this diet becomes very important. It's a very important way to change your bacteria. There are many books you'll find like this Genius Foods and all that. But this is a simple, so our IBD department based on the experience with the Mediterranean diet has come up with this. This book is available in our pharmacy. What are the diets that you can make based upon the ingredients which are available in our market to actually produce good bacteria. So if you start with there, I think 200 odd recipes in this, you can have a look. And once you change, then what happens is your bacteria become millions, because bacteria we know the most important area. But there are also some things in the diet which are harmful to us. For example, sugars we know. But what is more interesting is non-sugar supplements. For example, diabetics say that we are taking a non-sugar supplement. That is more dangerous than sugar. If somebody, diabetics ask me, I say, take little sugar if you want, but don't take all these sweeteners, because the sweeteners change the bacteria in the gut and produce bad bacteria. So don't take that. The other thing is like antibiotics, of course. I'll come a little to this toothpaste and plastics they can produce. But the reason why some of these foods that we eat are bad is because these processed foods, so-called ultra-processed foods, contain preservative, coloring agents, additives, and these are all extremely bad. So the worst enemy is ultra-processed food. Now, ultra-processed food is anything that comes in a wrapper. They are changing our bacteria, and that's why we're finding childhood obesity and so on very high in our, because of this ultra-processed food. And this is the worst thing for bacteria. Simple thing like toothpaste. I don't know how many of you look at the contents of the toothpaste. When you go back home, look at it. If your toothpaste contains titanium dioxide, it is very bad for your gut bacteria. Because this titanium goes inside and dramatically kills all the good bacteria and the bad bacteria come out. This is extremely harmful to us. And unfortunately, some of these toothpastes having titanium dioxide are very tasty for children. They not only brush the teeth, then they swallow it and then changes the bacteria. So kindly, if you're using this type of toothpaste, I don't want to put a label because I'll get sued by the company, so I didn't put a label, but if you're using this kind of bacteria, you have to change this toothpaste. And all these processed foods, in fact, chips and burgers are not because of calories, but because of preservatives they contain. They're changing. We've done a lot of work in this area. Believe me, they're changing. In fact, we've written to the government a white paper because what you find is now there's a rule that around colleges you should not have any alcoholic shops and all that. But unfortunately, around schools you have a lot of fast food areas. The school canteen itself gives you packets of chips and all these processed foods. That also should be banned. Just like alcohol is banned around colleges, fast food places should be banned around schools because children in the intervals are running and taking the chips and hamburgers and all that, and that is producing a dramatic change. And again, we have done a lot of studies in this area. Unfortunately, these children don't realize this, but it's producing childhood obesity, other problems. And antibiotic use, this is very, very important. Unfortunately, in our country, you can just go and buy an antibiotic and use. People take 1 day, 2 days tetracycline or some antibiotic, which again changes our bacteria completely. So this is something that should be totally avoided. Antibiotics only when they're extremely necessary. And of course, the other problem that has happened, especially after COVID, is we become too, I think, hygienic. That's also not very good. Some amount of our hands have bacteria in them. If we go on cleaning and completely eliminate bacteria, this is not good. There are bacteria everywhere, eyes, mouth, everywhere there are bacteria, different types of bacteria. If you make yourself too sterile, that is like you're becoming a germ-free animal, that's not good. Some amount of unsterility also is okay. The stress also is another thing that causes, stress causes a marked change in microbiome and causes bacteria. And now I'll come to the shocking aspect. I'm telling you something which we follow strictly now, at least will make you a little more healthier than what you are now. And this is plastics. All of us drink from plastic. Unfortunately, even in a hospital, you're not able to change the plastic water bottles, right? Plastic water, especially the disposable plastic water bottles, even the more reusable ones, continuously are leaching plastics into the water. If you drink continuously from plastic bottles, you are getting 5 grams. I think somebody is drinking from plastic bottles. Yes. So you get 5 grams of plastics every week. And these plastics become nanoplastics in the body and they alter the bacteria. So if you're now, we are also trying to change over to glass bottles. It becomes a little more expensive in hospital setting. But yeah, in your homes, as I just stop plastic bottles, change because plastics are changing the bacteria. Again, we have done a lot of work on this. Many of us, keep plastic bottles in car, in between. And this again, the amount of plastic that leaks out kept in a car because the heat and all is double. You get 10 grams of plastic every week to start drinking from there. So this is one. The second, other important thing is you do exercise treadmill. You do a treadmill and drink immediately from a plastic water from a plastic bottle. It is dramatically dangerous. The reason is when you do exercise, your gut becomes very vascular, and this plastic is damaging the bacteria and getting into the body immediately. So one of the most biggest health hazard identified now is drinking from a plastic bottle after a treadmill. And of course, third problem is all of us are getting from Swiggy. You get those microwave. They say plastic but microwavable, and then you put it in a microwave and then eat. The amount of plastic is 3 times what normally you get. So this combination, and I'm sure in our life every one of us is doing one of these at least. So this combination is the one which is causing a lot of damage, and again we are doing a lot of work on this. Many, surprisingly, some of the young people who have died of coronary heart disease, when we look at their arteries, when you look about plastics, what is deposited, you find a huge amount of plastics. So this guy is going to gym every day in the morning, very vigorous exercise, muscular, looks very healthy. Gym after every day is drinking from plastic bottle, a liter of water. All this is going up and then producing it. So this combination of plastics along with the microbiome is one of the biggest health hazard now in the modern day. And this is something again which we can control very easily. So right from today you stop the practice, your health span probably will increase another 2-3 years at least. You can think of it. The reason why we are talking about microbiome at all is that we now have evidence, again very good scientific evidence, that most of the diseases in the GI tract diseases, metabolic diseases, malignancies, skin changes, brain, all are related to microbiome changes. And this is a very recent knowledge, just 2-3 years old. So everywhere, all over the world, people are now rethinking the disease pattern, what is, and how microbiome can be changed. Because this is, and there are a couple of at least 2 or 3 Nobel Prize winners who got the Nobel Prize for working in this area. So this is something very exciting, a lot of new knowledge coming. And I told you the way we can change our microbiome is by, of course, transplantation of microbiome from one gut of one person, another person, very easy. But diet is the most important thing, and diet is something we control. Very easy to control. So this is again unique. There are actually 5 zones in the world called the blue zones. I don't know, you must have heard of the blue zones. In these blue zones, particular areas, you can see Loma Linda, and Nicoya, Sardinia. In these 5 blue zones, most of the people are living above the age of 90 years. Largest number of people over the age of 100 years are in these blue zones. So people wanted to know how come these people live so long, what's the difference between these blue zones and others. Again, a lot of work, and the main difference is the microbiome in the gut of people in the blue zones compared to non-blue zones. So these people have special type. Now we identified what microbiome, and now we can package them, and this can be given to healthy people to change. So I think we have learned a huge amount of knowledge. We know that human microbiome comes very early in life at birth. Over a period of time, good bacteria, bad bacteria are constantly fighting with us based upon our food habits, exercise, plastics and so on. One wins over another one. So bad bacteria, we know over good bacteria, and that gives rise to problem. So the next frontier of medicine is not going to be tablets. We're going to change completely. It's going to be all these tablets, what we're giving, everything will be replaced by a combination of good diet and rationally designed microbiome put into capsules. And we just started these studies now. We got a machine where we can take the bacteria in the gut, take out all the good bacteria, put them into a pill and give them. We just started this work. So I think this is extremely important. So this is something that we have been finding over last few years. In fact, now we are becoming so aware of this that we want to now look at what is the microbiome of each. So we got this gut microbiome lab now where we can take your stool specimen and tell you how many good bacteria you have, how many bad, what you should get to do good bacteria. So we can simplify this further. This is called a smart toilet, and we are getting it soon into AG. So what you do is smart toilet, you do your job in the morning, and then the toilet immediately has got a small chip at the bottom, microbiome chip. The chip takes all the data from your stool, and as you're finishing your job, it actually tells you what is your gut microbiome. Say today your gut microbiome is in bad shape, you have more of this type, so start exercising a little more, eat some more carrots and so on. So we have this ability now to test. In fact, this was something we thought which was not realistic, but recently I was in Hong Kong in a microbiome meeting, and I found they're already selling this in China and Hong Kong. So AG will be the first hospital to get one now. We're just working with these people. So you can actually estimate what is your microbiome on a daily basis and keep adjusting your diet and other things on a daily basis. So this is, I think, a watershed movement in human biology. In fact, people believe that the whole concept of medicine, good health, longevity, everything is going to dramatically change based upon the current data that we are getting in, and every day at least 1,000 new articles are being published on microbiome in the medical field. So it's a huge new way. So I'm not sure if God is omnipresent, but microbes are. They're everywhere in the body. Thank you very much.
I would like to open the floor to some questions if you have for Dr. Nageshwar Reddy.
I can hear you. There's a mic there, but there's no problem. Yeah.
Is it the food which is causing inflammation, or the gut microbiome which is turning the food into an inflammatory kind of?
That's a very good question. In fact, the so-called inflammatory and non-inflammatory food is based not on the food itself, but the ability of this food to actually encourage good bacteria or bad bacteria. All the so-called inflammatory foods are bad foods are those which are, of course those foods, they all change the bacteria inside into bacteria which produce a lot of bad substances, which can again go to the gut and so on. So the whole concept of nutrition is now not based on nutrition, but based upon what happens to the bacteria when you take this food. So all the ultra-processed food, for example, every ultra-processed food will come under an inflammatory food.
The ultra-processed food is inflammatory, that we know, sir. But natural food also, few people will be having inflammatory symptoms with one kind of food, and others will not have inflammatory symptoms with that kind of food.
So the same food can have different reactions in different people because of, we didn't understand this till now. And now we know it's because of gut microbiome. The changes it produces in some people. That's the reason why for some people if you can eat a lot of sweets and still maintain yourself, you don't put on weight. Whereas others just one sweet once a week you put on. So it's because of this, how bacteria takes up this food and processes it. So this is very different.
So we need to define which food is
Yes, so you have to define. So this is still not in mainstream medical practice, but we are doing it a lot in institute where we take the stool of the patients and then we're doing detailed analysis. We analyze all the 1,000 species. We know what type of bacteria in your gut, whether you have this pro-inflammatory bacteria, anti-inflammatory bacteria, what toxin producing bacteria and so on. All we know when we analyze this.
Okay, sir. Thank you.
Good afternoon, sir.
Hi.
Hi. Sir, I'm a PhD in diet and nutrition, and I have been always telling my patients who are lactose intolerant that you should never completely stop having milk products like curd or sparingly use paneer. Sir, what is your take in that? Do the gut microbes, do they increase after a time? Do the mental status or the vagus nerve have a role in it?
Yeah, so good question. I think as not only dietitians, we also tell people that by Indians by the age of 20 years, most of them become lactose deficient. So whenever you give something containing lactose, they will start reacting, they'll have gas, sometimes diarrhea and so on. But fortunately, when it gets converted to yogurt, the lactose component goes up. So we can give them yogurt as a substitute, there's no problem. But also I think this is a new knowledge that we're getting. Some of the bacteria in our body also contain this enzyme lactase. So even lactose intolerant people, when this lactase containing bacteria increase, can start taking milk. That's why suddenly somebody who is lactose intolerant can start taking food, paneer and all that, because the lactase containing bacteria are dramatically increased in the body. So even that knowledge is very new, it's coming up now, and this is very interesting. Yeah.
Sir, I have another question. Some people come and ask me, can I have a spoon of ghee or a spoon of coconut in the morning coffee or tea?
Yeah.
Does it help in combating the acidity?
So this is another area, but anyway, I think small amounts of anything is okay. It's only in moderation, I think body tolerates everything. There is some evidence that ghee in small amounts actually is good for our body because certain types of fatty acids and all increase which are good for the body. So, but only when they overdo it, take, let's say, you tell your patient ghee is okay, then he'll have 3 times he'll be taking spoonfuls of ghee. That's bad. Yeah.
Hi sir, this is Shubhra Maheshwari. I'm past chairperson Vicky Flow. First of all, at the onset, I would like to thank you for giving our city an organization like AIG. Having first-hand experience, it's said that it's not a best thing to be visiting a hospital or a doctor. But if somebody had allowed me to rechristen AIG's name, I would call it a very holistic health center, having first-hand operational experiences with Dr. Srinivas Kishore, with Dr. G.V. Rao, and at some time you can always say that one doctor is good, but how can you have every doctor who is so supremely brilliant? And while I'm at it, I would also like to mention that very recently, Dr. G.V. Rao has been treating my son since 4 months, and we see him every day, every fortnightly, night 9:30 p.m. And my son asked him, Uncle, why do you work till so late? And we are not the last patient, like he has a huge hall waiting. And his reply was so touching that also made me understand what you have instilled into an organization like this. He said that, Vivan, the younger generation is busy trying to strike a work-life balance. So at the senior level, we need to attend to people. So that was so amazing, and it's always so good that whenever there is a problem, I feel coming to AIG is like coming to a health rejuvenation center where you will be cured and sent home very, very peacefully. So thank you so much for giving AIG to this country. And my question to you in general is that you've spoken about the Indo-Mediterranean diet, and your research sounds so good. So do we as normal healthy humans have an opportunity to experience this with AIG? Can we enroll with you and experience the benefit of Indo-Med diets?
Thank you, thank you. First of all, AIG is what it is because of all the doctors in AIG. We have outstanding people like G.V. Rao. I think the culture seeps from above down, and so majority of the doctors have the same ethos and culture, and that's why AIG is what it is. It's a constant effort we keep trying to do, and like you said, the philosophy is not cure disease people, but make people healthy. That is very important. So health is a little different from disease, and we try and see what we can do as best, but of course medicine has its limitations. Regarding this Indo-Med diet, I recommend that we will see if we can get the books across to the FICCI members. So we have a book where all the recipes are there. You can actually take this book and make it yourself.
But could there be a sample diet plan that we can understand?
Yes. So we have, we have a department of IBD. Dr. Nalini is in charge of all these diets and all that. She'll be able to organize this for you so that the method of cooking, what ingredients to use, what are the healthy components, and all that can be explained in detail. Because for us to develop this Indo-Med diet took us almost a year working with this nutrition institute in Israel. So it was a long process. But I think it's worthwhile to get into this because your diet health dramatically increases when you start taking this.
So if you could connect us,
yeah,
we'll
do
be
that.
happy to take a session from her or an appointment.
Yeah, maybe she can address once and take in detail or tell you what all the things are.
Thank you.
Hello, good evening, sir. Sir, I wanted to ask you a question on nowadays a lot of people are taking supplements more than the food.
Yeah.
I mean the natural food. So what is your take on that?
So supplements I think are overdone. In fact, supplements are good. They're good for the industry, not for you. So the industry makes a lot of money on the supplements. So basically there are few supplements which we require as human beings, like for example vitamin D, sometimes omega fatty acids. There are 2 or 3 of them only. But all these so-called additional supplements that are given are all actually not very good. For example, I'll tell you an example. There is a supplement which is given to substitute wine. Wine is supposed to contain antioxidant. And so to get that effect of the supplement, you drink 5 liters of wine every day. Now, if you drink 5 liters of wine, you may get all the antioxidant, but you'll also get liver disease, heart disease, and so on. So supplements are over-exaggerated. I think you must be very careful. Normal diet looks after all your, nature has made it such a way that it looks after all your needs. The need for supplements are extremely low. Vitamin D, we are asking people to take, because many of us are not exposed to enough sunlight. We're not having, Indians by nature have low vitamin D levels. So vitamin D is something that we substitute twice a year for 2 or 3 months. Otherwise, nothing else is required.
Sir, you said there's some, any specific daily habits that you suggest? I understand everybody is different. Their diets are different.
Yeah.
Can we trust AI or ChatGPT to give us a proper diet which goes with our body?
So ChatGPT will give you standard diet, and ChatGPT is not trained enough.
Yeah.
So what people are doing also is they're now training ChatGPT to take your gut microbiome report, look at your physical status, and then give the adequate diet. So that there's a special AI application that's coming. And once that comes through, maybe you can use it. But right now, ChatGPT.
Not now.
No.
So at least something that we can follow on a regular
Yeah,
basis. Thank you, sir.
Sir, one question. Sir, there are so many people who develop like lactose intolerance suddenly.
Yes.
Like I've been having milk since 40 years in my life, and suddenly you develop some kind of a lactose intolerance. Or so, I mean, does the bacteria change,
Yes,
or how
yes.
does it happen?
So normally, 80% or 90% of Indians become lactose intolerant by age of 20 years.
Okay.
Some are not lactose intolerant, but those other people who are not lactose intolerant are because of bacteria in the gut, which are actually producing lactase, which substitutes for the lactose. That's why the lactose intolerance doesn't come out. But any change in the bacterial, for example, if you had an episode of diarrhea, you'll find immediately you become lactose intolerant after that. That's because of changes in microbiome.
So how should we handle that?
So lactose intolerance actually is a normal phenomenon. You don't have to worry. Just that you have to change your. So you can't take milk, for example, the regular milk. You can take almond milk and other things. So that's the way of overcoming. So milk is not very essential. Unfortunately, human beings are the only species which drink the milk of another species. It doesn't happen in the animal kingdom at all. So we got used to that. So milk is not an essential thing. You can substitute with yogurt and so on if the calcium is a problem. So the best treatment for those who are lactose intolerant, avoid milk. There are other like lactate and other things available which you can use in your milk to help you, the enzymes that are available, but the best thing is to avoid milk. Your body is telling you this is not good for you, so better to avoid.
It's very difficult to understand that you've become suddenly lactose intolerant. You know what I mean?
Yeah, this is because of sudden, usually happens after sudden illness, you become lactose intolerant.
Good evening, sir. How carrots are helpful for the good bacteria?
So that's a good question. So carrots and those containing fibers have very high. So carrots, for example, has a very high amount of fiber. There's soluble, insoluble fibers, a lot of things in that area, a lot of soluble fibers. So this goes into the gut, and the good bacteria require fiber. They feed on the fiber. The good bacteria increase in number, whereas the bad bacteria require meat and so on. So if you have a lot of fiber, less of meat, the good bacteria, the army of good bacteria becomes strong. So it's opposite of human beings. If you eat meat, you become strong. If you eat fiber, not so much in terms of muscles, but in bacteria it's opposite. So the fiber-eating bacteria are good bacteria. So carrots, because they contain a lot of fiber, help you to get good bacteria.
And what is the difference between curd and yogurt?
Similar, I think yogurt, frozen yogurt in US is ice cream, but regular yogurt is same as curds. Other important thing is that when you are taking curds, the probiotic bacteria that are present in the curd is best in homemade curd. All these commercially available curds, especially those which are containing a lot of sweetening agents and all, are not good. They don't contain, even the so-called Greek yogurt and all, doesn't contain as much. What is made in the home is the best yogurt because that contains, the curd contains enough bacteria.
Thank you so much, sir, for enlightening us all on this topic. We were all staring at each screen as if, oh my God, this is also happening. We now have some myth versus fact questions for the audience, just to liven up the atmosphere. Can we have the presentation again, please? It's going to be a quick rapid fire, and we'll show you what we normally think versus what the facts are. Does eating spicy food cause ulcers? Is constipation always harmless? No, actually, chronic constipation can signal deeper health issues. Are all probiotics the same? That's true. Different strains help with different gut problems. Can only alcohol cause liver damage? Obesity and hepatitis can also harm the liver. Is heartburn the same as acidity? No, they are different conditions and different causes. Does skipping meals improve digestion? No, it can disturb the metabolism and gut balance. Is yogurt good for everyone's gut? People with lactose intolerance may not tolerate it. Can stress worsen digestive issues? True. Does drinking water during meals harm digestion? No. Normal water intake doesn't dilute digestive juices. So that's all that we have. May I now invite Dr. G.V. Rao, please, for his session. Dr. G.V. Rao is the Chief of Surgical Gastroenterology and Minimally Invasive Surgery at AIG, a national leader in GI oncology and pancreatic surgery, a highly published surgeon with over 160 papers. Thank you so much.
Thank you so much. Thank the entire Flow executive and all the members for the honor of this podium this evening. As a surgeon, we work under bright lights for hours together without blinking. But surprisingly, when you put us in front of these gorgeous ladies, my heart flutters. Mind goes numb, and natural intelligence goes for a big toss. And my clinical acumen could decrease. And I'm talking about medicine, which is a combination of clinical judgment, clinical care, and empathy, seems to go for a toss when I stand before you people. And in clinical practice, this is variable. You must have seen different doctors practicing differently. It's inconsistent, and basically because of the physical burnout, situational pressures, and age-related issues of the clinicians also. So, I'll be talking about artificial intelligence in clinical practice. And why am I talking about artificial intelligence? You look at the IQ, which is the crux of the medical and clinical practice, because your clinical practice is based on your IQ. So you can see this, Dr. Reddy's IQ is 130 plus. He is a super genius, and you've seen his talk. And I am trying to compete with this gentleman. My IQ is somewhere around 100. There is no way that I can compete with this gentleman. So I have to take help of artificial intelligence, which has got an IQ of about 130 plus. So in our hospital, so to compete with and stay in par with what is happening with Dr. Reddy, we have to take some help of artificial intelligence in addition to our natural intelligence. And I'm talking about this basically because I come from Hyderabad. Hyderabad lingo is the first language and coding is the second language in Hyderabad. And that's the reason why I'm talking about artificial intelligence in clinical practice. And medicine has several challenges as in today, be it by diagnosis, you must have experienced this, different doctors give you different diagnosis. Choosing appropriate therapy, again, is variable, determining individual responsiveness. Dr. Reddy has told you why different patients respond differently. And how do we predict the future course of this disease, and how do you appropriately guide this management until unless we have the theories that Dr. Reddy has put forward about the microbiome that comes into clinical practice, and when we can normalize the entire practice system. And whatever we practice today seem to be yielding positive results in 50% of the people, and in the other 50 it's either overestimated or underestimated. So can artificial intelligence overcome the challenges that we have in current clinical practice? AI seems to be everywhere in the air. It's like oxygen and nitrous oxide. Understand? AI is everywhere. And 80% of the people here are used to AI, whether you like it or not, using ChatGPT, X, Y, Z. ChatGPT started making presentations, started writing essays, started taking exams better than human beings, started converting text to pictures, text to videos. So tomorrow if I have to show you that I have done a procedure like what Dr. Subramanian does it, I don't have to do the procedure. I text it, I create a video and show it that I can do it better than Dr. Subramanian. This is what artificial intelligence does done in clinical practice. And medicine seems to have everything that artificial intelligence needs. Huge amount of data that we get from records, from x-rays, from endoscopy, laparoscopy images. And I'll not bore you with the AI language, but ultimately what it does is, it creates algorithm that helps in diagnosing, preventing, follow-up of this patient, and also seeing how research can be done and enhanced in clinical practice. And not only in medicine, the same thing is happening in all the other specialties. This is basically happening because of the computational power, the supercomputers that we have, and it is shown that the new Google quantum Willow chip can outdo the super classical computer, what it can do 10 septillion years. So what we predicted was going to happen almost about 5 decades from now, we'll see it happening in the next 5 years or so. The result is that the entire practice of medicine, in the first half of the evolution, it was at a very snail pace, basically because natural intelligence, except for few people like Dr. Reddy. But AI has added to an entire concept of this, and the pace at which medicine started translating is dramatically improved right now in the last decade. Phenomenal. And India stands number 3 in the number of publications that we have in artificial intelligence, basically because of the huge AI support and the IT support that we have in India. I'll give you some simple example actually that happening at AIG hospital. All the patients who are admitted to AIG hospitals are hooked to this EMR records right now. So it is likely that you're not seeing the patient continuously, but the war room that we have in the AIG hospital is continuously monitoring each and every patient here. So it is alerting us which patients are going to turn sick. So even before you're going to attend the patient, as in today, it is alerting us. So the number of code blues, I mean, maybe you hear a code blue right now, but the number of code blues that happen in the hospital have dramatically reduced basically because of this. And we thank AI for this, and we are able to salvage a lot of these patients because of this system that we installed. Something that we show you, actually you must have seen a lot of you people, some of you family members undergone endoscopy to pick up lesions. I'll just run through one story. Now we use white light, and now using AI to pick up lesions which are not seen on white light. So you can see on the right, we have an image that is enhanced by artificial intelligence. So even a no-voice endoscopist, as a surgeon who is doing it, can pick up this lesion without missing it. Now, a step forward. Now what happens is, to see whether this lesion that you're seeing is benign or malignant, we again incorporate AI into this. Now even before we see whether it's malignant or benign, this AI maps out the area, saying that this is the area you're supposed to concentrate on and look more closely into the thing. So even for a no-voice person, it is alerting the person. So you can see that it is mapping that area and it's alerting us. The next thing is that actually now we have an endoscope which has got a microscope attached to it and artificial intelligence attached to it. So the moment you touch the lesion, it will tell you whether it's a benign thing or a cancerous thing. So we don't have to wait for the pathologist to tell us. So the moment you touch the lesion, it will tell us whether it's a cancerous thing or a non-cancerous thing. Suppose still you're not convinced, we have another technology called as confocal biopsy. You take a small bit of tissue and then put it under this fluorescein microscope. You don't have to wait for 10 days to get the biopsy report. The images that we get are absolutely similar to the conventional histopathology report, and all this happens in less than 2 minutes. This is what is called as the vivoscope or the confocal microscope, and it seems to be dramatically cutting down the amount of time that you have to spend for the waiting times of the patient. Once you've seen this lesion, what happens is then you have to treat these early cancers that you've detected. Now AI is helping us, a no-voice surgeon, to plan for this surgery. Now you can see this, one of these procedures being done. As the procedure is being done, the vessels which getting highlighted there, and the artificial intelligence tells the no-voice endoscopist that this vessel needs to be coagulated, otherwise it's going to bleed. For an experienced person, it may not make a difference, but you understand, for training students, it becomes very mandatory. Capsule endoscopy, so all of you, somebody would have seen this. Actually, you swallow a pill, it takes umpteen number of pictures, it gives a report. Now, we have a dynamic capsule. As the capsule is going through, we can maneuver this capsule with a joystick right now. And the biggest thing that is happening is now this capsule is getting loaded with drugs, clips, medicines. So you can swallow this capsule, it can go into this small ball and it can treat the disease then and there itself. And you can remotely control this with a joystick. So that's the reason I think we start playing with our grandchildren to make sure that we get used to the joysticks so that we can maneuver this capsules very well during the procedure. Also, we have this, actually everybody talks about fatty liver, you get an ultrasound scan, actually somebody tells you fatty liver, grade 1, grade 2, grade 3. And to quantify this, they do a test called fibroscan. This fibroscan is expensive as in today, even for most of the people. So we have designed an algorithm that is almost 1/10 of the price based on some blood parameters, and we have validated that it is equivalent to what we see in a fibroscan. So we don't have to go through a fibroscan, and now this model we are replicating in the rural India to make sure that that costly test is not done. We are simplifying the entire test to detect the fatty liver in these patients. Wearables, actually I'm sure 80% of the audience here are wearing some device or the other. Now this is a powerful clinician-patient interface that is linking us, and we at AIG are very fortunate to link with our patients actually. We are continuously linked to all these patients. This is Gen AI. It enables a 24/7 contact with the patient. And this is changing the way in which we're treating the patients, enhancing clinical judgment. And in not those distant future, actually, we have a Gen-enabled modification that can happen at home. From endoscopy, I'll switch gears to what is happening in surgery. Actually, Dr. Subramanian is also here. We have a lot of technologies that we use in the theater. Umpteen number of gadgets are used in the theater, including some contrast to see what you're not able to see on white light. We inject something to pick up some nodes. Ultimately, the result is to have good outcomes. We inject some contrast to pick up nodes to make sure that what you have done is absolutely satisfying. This has made life very comfortable for us, and it has also made good outcomes for us. And also, what is happening was, actually, these technology are telling us the type of lesion that we have on table. Like this is a patient who's got a liver tumor. But putting in this technology, that will tell us whether it's a well-differentiated, moderately differentiated, poorly differentiated cancer. In the sense that it's helping us making an on-table diagnosis, changing our line of management on table so that we could have better outcomes on the patient. Simple technology, and also this technology now is helping us to better do surgical procedures, better do surgical get into planes, and we have more R0s resection. And then just, I'll give you a simple example. This is an AI-generated model. As I'm doing the surgery, constantly it is flickering on one vessel. I'm staying away from the vessel, but this AI keeps telling me that this vessel that you're avoiding has to be dealt with. If you don't deal with it, it's going to bleed. So even when my concentration is not on the vessel, it keeps alerting me constantly till I tackle this vessel, it is not going to leave me. So back of the mind, when we have this, actually, it is helping us to make sure that the procedures are safe, and it is also making us help in different advanced procedures to make that the outcomes of these procedures are very good, but telling us whether this is adequately vascularized or not, to an extent that artificial intelligence is telling us, predicting the success even before I put the knife on the patient. That is the way AI is predicting. And I told you about white light, blue light, Now we have a project that is going on in AIG called Octopus. Now this machine changes colors depending on where we are operating automatically. And it enhances lesions, downgrades some of these things so that the procedures become safe. 6 months from now, I'll be able to show you this project. A lot of the talked about inflammatory bowel disease, irritable bowel syndrome, Crohn's disease, ulcerative colitis. We have a lot of work that is being done at AI in AIG hospitals. We are able to differentiate between Crohn's and non-Crohn's using artificial intelligence now. And some of you would have seen this patient, some of these patients have these stomas in their abdominal wall as part of surgical procedure. But biggest problem with these patients is actually it leaks continuously into a bag that is attached to them, and they have to constantly empty this. Now we have a technology wherein it's called a continent stoma. It is like a cap on the bottle. You cap it and the patient can empty at his or her convenience. There is no artificial intelligence in this actually. So best thing is what we did was we put sensors into this right now. So now this sensor is attached to the mobile phone and it gives us the pressure to the patient at which pressure he or she has to go to the toilet or empty. And as Dr. Reddy has told you, as technology evolves, every possible sensor can be put into this, and so that we'll be able to monitor patient continuously 24/7 using this technology here. It's like a smart toilet getting connected. The end result is actually in theaters, actually we incorporate all this technology together. Actually you don't know what happens in the theater. You feel that patient just goes into the theater and then some surgical procedure is done, patient walks out. But we integrate all this. It is like something like having a Google map in our theater. We superimpose this map onto the machine and then it tells us point A to point B, which is the easiest route to go, which is the least traffic, which causes less blood, which causes maximal good outcomes. You understand, this is the technology that we have as of today that making life easier for surgeons and the outcomes are getting better. Robotic surgery, Roma Sinha is here, actually the biggest robotic surgeon. The myth is that people believe that robo performs surgery. It doesn't. It is aiding surgeons as in today. But what happens is actually, if you know what happens in the theater, when you go do some laparoscopic procedure, your assistant will hold the camera for you and he'll show you the image. Then you recognize on the monitor what it is. Then you decide what to do and then you move your instruments based on that. Now AI is getting into each of these fields. In the sense, it is able to show, it is able to recognize, it is able to move, and it is able to decide what to do with an accuracy of almost 90%. The end result is the first ever procedure done using artificial intelligence where the system is performing the surgery, not the surgeon. The system has been trained so much that it does the surgery on its own. Something it looks very dangerous, but I think we're all looking out for what is going to happen. And all of you would have seen movies like this actually which show what is going to happen in future. We have chairs which can detect every possible. You sit on the chair, it will give you all the parameters. You sit on the toilet, it will give you all the parameters. So a day will come when the patient just has to go and lie on the table. It will make a diagnosis, make a treatment, and then he or she will walk out of the table. I thought all this will take almost 2 or 3 decades to happen. I created my own image, 2 decades younger. But this person makes quantum below, and I don't have to become like this to see what is happening. I'm going to see all this happen in the next 5 years. So there are a lot of concerns about artificial intelligence in clinical practice. Who will buy the thing? Who will buy the licenses? Legally, who would be responsible? Who will validate all this to make sure that it comes into clinical practice? What if the system crashes and the whole thing goes for a toss? And what if corporate rivalry and then somebody hacks your system and then the whole thing goes into the world? But as we embark on this AI journey, we are not just creating characters, avatars and humanoids that simulate emotions, but we are also fostering an undeniable intellectual connection and involvement with these elements, whether you like it or not. And there are a lot of science fiction movies which can show that what if these bioengineered human replicants, indistinguishable from humans, start believing themselves as humans? And what if these created people start controlling who is who? These can happen. And what if I fall in love with artificial intelligence that we create? And my entire thing can go for a toss. So these are the limitations that we have. There are people that who feel that AI is making human people dumb. Recently, there is a big article that is going on that ChatGPT makes people dumb. It is something like saying alcohol causes cirrhosis. No, it doesn't. Alcohol doesn't cause cirrhosis in each and every patient. If you're taking it too much, it causes cirrhosis. The same thing, actually, it is a paper that is published, but it's not that anything in moderation can be good for the population in general. So for people who don't believe in artificial intelligence, you understand, the people believe that artificial intelligence is all humbug. Now we have a competing technology that is coming in, that a natural intelligence can be augmented by having an extra hard disk in your brain. Increase your processing speed. I think some of you would have seen this movie. You have an extra hard disk and then it improves the processing speed. People thought, again, it's an absurd idea, but Elon Musk makes this possible. He puts a very chip in the brain right now. So whether you like it or not, people are going to do this. So as surgeons, we always believe in precision, except when it comes to the eye and the eyeliners. And that's the art beyond natural intelligence, surgical skill set. And we are trying to see if we can depend on ChatGPT. Now I put a question to ChatGPT. Understanding women is beyond the scope of natural intelligence. Beautiful answer. He says, I appreciate your perspective. If you have any other questions or need assistance, feel free to ask. Have a great day. It goes on to say, I apologize my previous response caused any inconvenience. If you have any other questions or need assistance, feel free to ask. Have a great day. And I ask, can AI understand a woman? It says yes. All the emotions can be understood, analyzing voice patterns, monitoring eye movements, it can analyze. And every possible system, AI system that we have is named after women. Alexa, Siri, etc., etc. And as a tribute to the women here, AI in general, AIG, under the chairmanship of Dr. Reddy, we have something to do with women. We have created Mira. It's a medical information robotic system. I'm sure the audio is not connected. Can I have the audio? It tells us it is helping all the attendants right now to answer all the questions that you raised, because we are not spending that much of time with the patients. It is able to answer all possible questions that the patients have. Phenomenal thing that has happened. It tells us that it's going to assist doctors. The other thing that has happened was we started this again under the stewardship of Dr. Reddy. It's called Janani Mitra, wherein we get connected to all the women, pregnant women. As in today, it's connected to all the pregnant women of AP Telangana. As in today, we have about 50,000 pregnant women who are connected to us. Each one of them, as Dr. Reddy keeps saying, we have more smartphones than toilets in India. Everybody has got a smart toilets. So we are monitoring them, whatever they eat. We are monitoring their vital signs, and all concerned are being alerted appropriately. And surprisingly, the dramatic changes made was the number of deaths that we have, infant mortality, it is dramatically reduced. I think we're going to publish this very soon. This is going to come, and then the government of Telangana and Andhra Pradesh have accepted this. And Dr. Reddy has put forward this proposal to the government of India, and I'm sure the government of India will take up this proposal basically because of the huge response that we have, huge positive benefit that we are having from this project that we launched at AIG Hospital. So to conclude, the disease management is very complex and very expensive as in today. Improving clinical efficiency and optimizing healthcare resources is of paramount importance. Evolving advances in artificial intelligence are promising, with potential to revolutionize diagnosis, clinical care, detection of lesions, tailoring treatment, improving current, survival and predictive treatment response. And AI is helping us in identification of new associations between variables, potentially leading to changes in clinical practice in future. So whatever is deficient in clinical practice, please accept our apologies. We are trying to, every science is improving day by day, it's changing day by day. We hope that natural intelligence in combination with artificial intelligence would make a big impact on the way in which we practice medicine in the future. Thank you so much once again for the honor of this stage.
I would like to open the floor to audience questions, please. After which we have a fact versus myth. We have a question there.
Very good question actually. As in today actually, if you see, differentiating IBD in our country is very difficult because we have tuberculosis and IBD which mimic together. I showed you a project which differentiate IBD, Crohn's disease, from non-Crohn's disease. That is helping us to differentiate. Otherwise, what is happening is, as in today, when you're not sure about the diagnosis, you start the patient on both anti-tuberculosis treatment and anti-Crohn's treatment. The second thing is actually, umpteen number of drugs are available in IBD therapy. Actually, they call it step-up therapy, step-down therapy. You're absolutely not sure which patient is going to respond to which sort of therapy. AI is helping us to see which is the optimal treatment plan for this. Second, umpteen number of biologicals, biosimilars are available in the market. Again, unless until we start the patient on these, we cannot monitor them. So AI is helping us, based on the gut microbiome studies that Dr. Reddy has told you, which medicine is ideal for this patient. Thank you so much. Yes, actually, if you have any, please, we'll be more than glad to. We have a very good IBD team here, and which is supported by a lot of microbiome department also, and the dietitians is supporting the department. We'd be glad to be of any help. It's just artificial intelligence.
We are all very new to the topic, so I think our questions are a little less.
Thank you, sir.
So India is becoming a hub for all the advanced surgeries. Now we see so many people come here to get, even for a dental thing, I see people coming from US and getting things done. So what sets Indian surgical practice apart from global standards today? What is it that's making this difference?
Actually, it's an unwritten thing in the medical field that the Indian clinicians are the best clinicians across the globe. Whether you like it or not, people across the globe, even in very advanced countries, agree that the Indian clinicians and the surgeons are the best. Even if you go to any US, people will flock to an Indian clinician rather than to a white clinician. We are not saying that this is basically because we have a very intelligent species of human beings who are taking this specialty, who are taking this to a new height. But we had always deficiency in getting technology to our country. Last few decades, 2 decades or so, has totally changed this, and then in fact, we get the technology even before any other country right now. That is basically because of the clinicians who are using it. People have realized this late, but last 2 decades has made a dramatic difference for us. Actually, all the surgeons here will agree with me that some of the technologies that we use are even before it gets introduced into the US market. So what's making this just not technology, but the person who is using the technology also has to use it very aptly. So we have the best combination of people who are good clinicians, surgeons, and who are using this technology to the core, and the outcomes are good. And obviously, as you rightly said, most of them are coming here basically because it's cheap. I know people who travel on a weekend for a dental checkup here. It works out cheaper for them to come here and go back and spend time with their families. Cosmetology, but I'm sure actually, whether you know it or not, actually UK outsources or majority of its surgical patients to India. Most of them, because their waiting list is almost about 6 months to 1 year for some benign diseases like prostate, hernias and all, it takes 6 months to 1 year. So it's all outsourced to India. So most of these patients coming from outside the country too. So in addition to the burden that we have, we are also tackling the patients in the world. This is something that is alarming actually. Subramanian will again tell us that actually, same thing actually. Instead of giving benefit to our patients, who are huge numbers actually, I don't know whether we are right time to take with this international patients. That's a big debate actually. It's a variable thing from institute to institute, but because the burden is so high within our country that actually I don't know what is going to happen, so we should train more surgeons to make sure that we take care of this burden.
Yeah, and I really have to thank you all doctors who give so much time. I mean, you are working from morning 7, I just got interacted till night 9, 10. I mean, you just 11. All of them, which is, I think, really, really appreciable. I don't know how much you dedicate your life into, your profession, which we all have to thank for. Otherwise, if you are not there, then, it's, I don't know where our situation would be.
I told you, if you're not there, our heart doesn't beat. Our heart beats.
No, because there are
so
small little things also. My son went to UK and they said, okay, you just go and do this yourself. I think a sea urchin hit him. He went around, I think they said, no, you can do it all by yourself. Nobody was there was no doctor for so many, 1 week. He came back here, within a day, our doctors came, come, I'll just do it, and he was fine. I mean, that fast our treatments, are, and approachable. Thank you so much.
So one question, yeah, last year, autumn. It's really mind-blowing and appreciated to see the collaboration of AI in medicine. This question is it ethical and the legal concerns concerned with the issues of the patient's privacy, the data security, and the AI-driven errors, which still require robust regulatory frameworks yet? So who is responsible for the AI-related mistakes then?
Very good question actually. See, what is happening is actually AI practice is not different from natural intelligent practice. The process in which AI is developing is similar to natural intelligence. The way that algorithms are written, every single algorithm, it is not that I write an algorithm and take it to clinical practice. It has to be cleared by the DCGI or the FDA, it has to clear it. Everything, like what we do trials in natural intelligence, we have to do trials in artificial intelligence. We have to have this evidence-based medicine to show that, yes, it is worthy doing it in practice. Now, who is responsible for this? Actually, suppose if I am using some technology today, I cannot blame the technology for what is happening. It is the surgeon who is ultimately responsible, or the physician who is responsible. I have to aptly use my judgment to see which algorithm is better. So legally, yes, I am responsible for it. Unless and until there is some tactical error in the algorithm itself. Otherwise, the person who, if I am prescribing it, I am responsible. If I prescribe a drug, I am responsible. So ultimately, but the legal issues, actually, as we are talking about AI in medicine, the judiciary is also working on the similar thing. Actually, recently we met the Chief Justice of India. He tells us that they got AI incorporated into the thing and they're able to fast track everything right now. So as we are doing AI in this, actually every single specialty is incorporating. So in the fast tracking AI in judiciary also they are incorporating. So the day might come when they'll say, okay, you'll have the lawyers who are arguing, maybe the AI will argue on behalf of you.
Privacy, patient's privacy.
Natural intelligence, we prevent. But this is a very good thing, unless and until you want to sell your data to somebody else. Actually, this is purely, we take the consent of the patient, every single patient, we take the consent, tell them that this is what you're using for. And the current generation is so proactive that they want to share this for the next generation. It never used to happen before, actually, including the same thing used to happen for organ donation. People were hesitant, but now the current generation is so apt to the thing, they want to make sure that they are part and parcel of the next thing that is happening. So they're all very keen to share this thing, actually, but it is all protected.
Thank you.
Thank you so much, sir.
Mantri is faster.
I will not say that actually we have not replaced anybody actually as of today, but it is helping us. See, Dr. Reddy puts it very aptly. He says, all those doctors who are going to learn AI will stay in practice. All those who don't learn, maybe they'll be out of practice. It's a part and parcel of what is happening. We keep changing what is happening with times. So whether you like it or not, actually, you're part. As of today, actually, all of you are using, 80% of them are using ChatGPT, Perplexity, anything actually. So it is a subconscious thing that you're using, but you might deny that you're using it. But subconsciously you're doing it actually. So it is going to be part and parcel, and we have to live with it.
Thank you so much, sir, for giving us the wealth of information on AI. A few fact versus myth. I'll make this fast. We are running a little behind schedule. Do all abdominal surgeries require large cuts? Can we switch to the presentation, but I'm continuing with the questions. That's correct. Minimally invasive methods need only tiny incisions. Is keyhole surgery unsafe compared to open surgery? Dr. Ruma Sinha is right here in front of us and she's answering all the questions. Can gallbladder stones be dissolved with medicines? The answer is actually no. It's safe. Surgery is usually the only effective cure. Can appendicitis be treated permanently with antibiotics alone? No. The answer is no. Surgery is typically needed for complete cure. Do small hernias not require surgery? No. So the answer is untreated hernias can grow and cause complications. With this, I invite Dr. Ruma Sinha. I think we're all waiting for her session as the most pertinent women's gynecological issues. Dr. Ruma Sinha has helped shape this health conclave. We've been in touch with her ever since the very beginning. I've been calling her endlessly, irritating her. Thank you so much. She's a senior robotic surgeon at Apollo, a national leader in minimally invasive women's care. She's also the president of the Asian Society for Gynecologic Robotic Surgery. Welcome, ma'am.
Thank you, Rashi, and thank you, Pratibha, and all the executive members of FICCI Flow and all the members that have joined us today. Hello, Dr. Reddy, Dr. Sabhareshwar Roy, and Dr. G.V. Rao. I think the two of you really set the stage here and talked so much things, and I think I learned quite a lot from that today as well. But I think all the ladies sitting here are really wanting to understand something that is really pertinent to you and actually matters to us almost every day. So let me start by saying one line. What is the role of gynecologist who can help you stay young and of course also healthy? This is Hyderabad. Our Charminar is very fast moving. All the AI and the robots and what we are doing is really on top of the graph today. So the first question that would come to anybody's mind as women is, when should you see a gynecologist? The commonest reason you see a gynecologist is when you get pregnant, right? After the pregnancy and the delivery, you just forget what gynecologist is and whether you have so many patients who come in their 60s and say, the last time I went was when I was pregnant. So I'll take 5 top concerns which bothers many of us, which could be a gynecological related, or you could work with it with a gynecologist. So these are the 5 top concerns which I'll take in what I'm going to discuss in the next few minutes, and that's about abnormal uterine bleeding. Now we bleed from say the age of 11 or 12 till about 50 plus. In so many years there is an opportunity, or there is a time when it could be abnormal, and when would you get concerned about it? PCOD is the talk today. Everybody flashes us report in front of me and say, or they'll come into my office and first say, I have PCOD for so many years, and then what to do? Pelvic pain, we suffer endlessly, and of course menopause related to osteoporosis, and something that we keep quiet about, and that's urinary incontinence. So what do we call as abnormal bleeding, and when we should get worried?
Remember that every woman will have a cycle of their own, and it will not be the same for the person sitting next to you. So it could be 5 to 8 days, depending upon how many protection that you need and how many days in which the cycle comes. So these are the 3 points that you need to remember. If the cycle is coming regularly, it could be 28 days to 35 days, but that's normal for you. If your amount of protection that you need has been same over years, that's natural for you. But if this amount of blood loss is now increasing, or if it is now being associated with some pain or clots,
it is a time to pay attention to it. Don't say, okay, this month I'll just get over it and then I'll look into the next month. And that's how month after month we keep neglecting it. And it will lead to anemia, weakness, fatigue. Remember sometimes that in the evening you are just too tired. You reach home and you say, don't want to talk to anybody, I don't want to listen to anybody. Because you are just probably low in iron levels. Your hemoglobin may be good, but you're still low on iron levels. Constant pain in the back or in the lower abdomen leads to poor quality of life. And of course, we also have things like we celebrate like International Heavy Menstrual Bleeding Day, which we talk more and make people more aware. What are the common symptoms? You can have heavy menstrual bleeding. You can have unexpected bleeding. That means between the two periods, you can have bleeding in between. Is that normal? Probably not. Or irregular cycles. You may bleed once in every 6 months or once in every 10 days. And that's abnormal. And of course, many of these talk about hormonal imbalance. So when I talk, in fact, even when I teach my students, I say there are two verticals when we talk about abnormal bleeding. If the cycles are regular but abnormal in terms of heavy, there's a structural problem. That means you may have a problem in the uterus like fibroids or adenomyosis or something, or you're in a cancer or something of that sort. But if you have cycles which are irregular, that means either coming too early or too late, the vertical is of hormonal imbalance. And that's where the problem actually starts, not just in your uterus, but from your brain. And even the stress could be a reason for that abnormality. So it could be stress, increased, too much exercise can also cause amenorrhea, decreased exercise can cause obesity and hormonal imbalance, change in sleep patterns. And remember, we all are now in a phase where we are working with time zones of different countries. So our sleep patterns have been changed, and this is a very, very valuable information for our younger women that we need to give. Any illness or use of new medications. Fibroids again is a common problem which many of you must have heard, many of you must have suffered or found somebody, one of your family members to suffer. It's 20 to 80% prevalent by the age of 50 years. Most common during women's reproductive years. But two things I'd like to say here very clearly. Number one, not all fibroids require treatment. So remember that any fibroid that has been detected incidentally can just be hanging there and can be left for observation for many, many years. Number two, fibroids cannot disappear by medication. I don't know about homeopathy or Ayurveda. But in the knowledge that we have, we don't have medications that can make fibroids disappear. And that is why, if it is symptomatic, we need to probably do. So what are they? They are just tumors which can cause abnormal bleeding, discomfort and pain, may even lead to infertility, may have difficulty in getting pregnant when you have these fibroids, can have bladder or rectal pressure, and of course discomfort during sexual intercourse. Options, there are basically three. If a permanent treatment of fibroids has to be done, surgical option is the most important option. And that could be anything. It could be either removal of the fibroid, removal of the uterus, depending upon who you are, what stage in life you are, what are your desires, what are your symptoms, we take this course. We have some non-surgical interventions as well, which is called uterine artery embolization or HIFU, or there are some microwave ablations that are coming in. So these are all that are just trying to burn the fibroid a little bit, make your symptoms better, but they again don't make them disappear. And of course, we can give some medical treatments which can shrink the fibroid for the time being. But as I said, the bottom line for treatment is almost always surgery. This is the kind of surgery that I'm trying to show in 1994, where I would probably be doing when I just passed out from a medicine. But today, we do the same surgeries for large fibroids by just keyhole surgery, which we just spoke about, as with the use of robots. In this era of minimally invasive surgery, remember that if you have gone to a surgeon or a doctor or a gynecologist and a surgical option has been given, remember to ask very carefully the reasons for not undergoing a keyhole surgery. Nothing in gynecology today, including many cancer surgeries, can be done by keyhole surgery, and I think Dr. Subramanian will highlight that very soon. So this is the kind of system that we use, that's called a console, through which we actually see what's happening inside the patient and then operate with a lot of precision, almost as if our hands are inside you. So we can operate with that amount of precision, safeguarding all the things that are vital, and go ahead and remove the disease for you. So let's come to PCOS. What exactly it is? It's actually used to be called as PCOD, which means disease, but we have changed this to called a PCOS, means syndrome. So it's a combination of certain things that can happen, and it's a condition of your body. It will not change by taking few cycles of contraceptive pills or any kind of hormones. Unless we change or control the condition of our body, they will continue to trouble us. So it is actually linked to few things. We have a genetic link to actually diabetes and insulin resistance. So now we also understand that PCOD is a metabolic condition. Thereby, if your diet is not good, if you are not exercising well, the PCOD will trouble you much more. A flash of ultrasound that says PCOD pattern does not make you PCOD. And I say this again and again to audience like you and also to my patients, that a diagnosis of PCOD is a serious diagnosis. Because if I make a diagnosis of PCOD or PCOS to you, it is a lifelong diagnosis that I have made for you. And I cannot make it frivolously. So this is what we call as a Rotterdam criteria, where out of these three things, that means anovulation or delayed cycles, biochemical or clinical evidence of hyperandrogenism like hirsutism or something, and an ultrasound picture. These are, out of this, two have to be positive for me to say that you are PCOS. It can cause sleep problems, hair loss, mood disturbance, acne, irregular periods, weight gain. These patients are very difficult losing their weight because they have insulin resistance. And we actually sometimes even give them insulin sensitizing agents, which is used for diabetes like metformin. But why it has become so common is because of our lifestyle changes, lack of physical activity. These pictures are saying a lot, and that's what has happened, especially to our young girls. Gone are the days when they would be cycling, swimming, playing with their friends. It's always either on a smartphone or a computer these days. So PCOS treatment, there are two levels. We need to have alternate treatment like diet, exercise and all those things, and of course have pharmaceutical treatment as well. But remember the three mantras. The three mantra basically means daily exercise, weight loss, even a 5% weight loss from whatever you are, and change the diet. I think Dr. Reddy also mentioned a lot about pre-processed, ultra-processed food, and this is also a part of the reasons for PCOD coming in. And what's pelvic pain? Who hasn't suffered from pelvic pain? If I ask from show of hands, I'm sure all of us will put up our hands at some point in time. But we must remember that pelvic pain always is not gynecological. A lot of GI pain is also pelvic pain, right? But from gynecological point of view, what are the things that you should be concerned about? You should be concerned about a condition called endometriosis, and I'm going to come to it in a minute, urinary tract infections, chronic pelvic disease like infections, and of course also something that we call as fibromyalgia. And that is not a very uncommon, but a least diagnosed problem which we often miss. It's more than just a backache. About 25 to 30% outpatient attendance is only because of some kind of pain in the pelvic area. And 20% laparoscopies we do just to investigate, to find out what is the reason of pain, because nothing else tells us anything more. And about 10 to 15% of hysterectomies are done just to improve the quality of life of that woman from that pain. It's not all in your head. And when pelvic pain is really investigated, we find many times this condition. And I want to raise awareness about this condition because it's not that it was not there earlier, but we are finding it many more women suffering from endometriosis. The simple reason or understanding of endometriosis is, remember that in the uterus, there's an inside lining that is called as endometrium. And when that lining is available or is present outside your body, it actually grows with every cycle and starts bleeding, and that's what gives you the pain and trouble. Now, why it is more common now? Have the genes changed? Probably not, but the environment has. And two things have happened. One is a lot of environmental toxins like endocrine disruptive factors, which are there in the plastics that we are using. And of course, also our physiology has changed. Earlier, women would get pregnant by the time they are 20, 21. They would have at least 5 or 6 children. And then, amenorrhea or not having periods is kind of treatment for endometriosis. That's what we do with medicines. Women were naturally amenorrheic for many years in their lifetime. And that is why we did not have so many endometriosis earlier. But today, endometriosis basically needs attention and treatment for two things that you are suffering from. One is the pain, and it is really intractable. or it leads to infertility, in which we have a combination of suggestions like medicine, surgical interventions, or even IVF and things like that to help you. We do this kind of endometriosis awareness program for general public quite a lot because we want to sensitize mothers and grandmothers to understand that menstrual pain is not something to be ignored. Any menstrual pain that is intractable, not letting you do what you want to do, like going to school, going to college, going to work, something will not go away when you get married or have children. So that is something that we need to drill. If it is intractable, please consult gynecologist. A very common problem. Everybody has vaginal discharge, and it's just like any open cavity to the atmosphere will have some kind of discharge like your mouth or nose, and that's the same thing with vagina. But remember that if these three things are present, number one, if it is having some kind of irritation or itchiness, it has a foul smell, or if there is a presence of blood, especially if it is post-sexual intercourse, you must get a vaginal examination done by a gynecologist, and not that somebody sees on your face and writes 2 antibiotics. Well, this is now crossing all the reproductive years, reaching towards a menopause. Navigating the transition and having the knowledge to take care of yourself is important. Remember, nothing to be worried. We all go through menopause. It's just a phase of life. But why are we worried? Because we don't understand it. It's a natural phase. It can occur anytime between 45 to 55 years. It's a retrospective diagnosis. Thereby, meaning many of you come and say, when will I get menopause? I said, I don't know. Because unless you do not bleed for 12 months, I cannot say you are in menopause. I can do something and say, okay, you are there, you are reaching there, you're doing something. But I cannot predict it. And of course, the problems that you face in menopause is because of the declining hormones, especially the estrogen and progesterone. What can it cause? I've heard so many of you talk about, I'm brain fog, I can't think, zap, right? And that is mainly because of the extra exhaustion, and the muscles and the brain cells are not able to take it. Dry mouth, right? You can have tinnitus, you can have loss of breast fullness, brittle nails. Musculoskeletal problem of endometriosis is something, again, new that we are trying to understand, which causes a lot of muscle fatigue. You can have dizziness, you can have metallic taste, bladder weakness, you can have incontinence, bad body odor, and of course, itchy skin. And pins and needles is actually a very, very interesting, very few patients present where they say some worm is walking, or as if there is under my skin. And that's also one of the symptoms that you can have. But the worst and the most troublesome is a hot flash. It simply means that you will get a sense of heat in the upper part of your body, and then there will be a cold sweat. You'll be sitting in a room with air condition, everybody else is comfortable, but you are not. And there are some things that can trigger. Hot weather, wearing a lot of clothes, drinking caffeinated or a lot of alcohol containing beverages, eating very spicy food, stress, of course, and of course, taking hot showers or smoking cigarettes can trigger these hot flashes. The key health concerns during menopause, number one will be osteoporosis. Just come to it in a minute. Cardiovascular risk increases because you lose estrogen. Weight gain and metabolic syndromes are troubling you more. You can develop incontinence and pelvic floor weakening. And of course, loss of quality of life like mental health, depression, anxiety, loss of cognitive decline is also there. But one thing I'd like to just mention here in this postmenopausal is postmenopausal bleeding. Remember, if you have not had, or anybody in your family, aunt, mother, mother-in-law, not bled for more than 1 year, has been officially postmenopausal, and then has a bleeding, one must investigate it. And that investigation requires a biopsy. And we often do a hysteroscopic biopsy because 80 to 90% will be a hormone-related change. But we don't know about 10 to 20% whether it will be precancerous or a cancerous condition. And endometrial cancer is on the rise because women are living longer, they are obese, they have more estrogen in their body because of their obesity, and then it's a curable cancer if we diagnose it early. Now choose how you want to look. Do you want to look like this, need a walker to walk, or you would walk straight like this? So this will be determined with your osteoporosis. 80% women in our country are suffering from osteoporosis. And the risk of developing a hip fracture because of this osteoporosis is the combined risk of a breast, uterine and ovarian cancer. We are always worried we're going to get cancer. Have you ever worried that if you'll fall and get a hip fracture? And you just, if you've ever had anybody in your family, like grandmother or mother, have a hip fracture, remember how the life gets altered completely, right? 90% of hip fractures are due to osteoporosis, and 9 out of those 10 fractures happen because you fell. So this is, osteo means bone, porosis means they have holes in it. So this is the normal bone, and that's the porotic bone right there. Most fall happen at home. And we have to understand 3 F's: fall and the force with which you fall. So that could be because of loss of footing, traction. You could lose balance because of low muscle tone if you don't exercise when you grow old, because the muscles become weak. And of course, you are fragile. So these 3 F's can cause a fracture because of the fall. And then the point comes that we need to prevent that fall. Prevent that fall by making a lot of things change in your house, or if you have elderly at home, make sure there is some light there. They do not have too many carpets or small things which they can stumble upon. So, and handrails in the bathroom so that they can hold on if they are slipping. There's so many things we can do to prevent the fall, because osteoporosis is something which at this stage that we are sitting here, we have lost the bus. Because the concept of peak bone mass. And what does that peak bone mass mean? That when we are in the adolescent phase, probably up to 20 years, our bone is getting stronger and stronger by more and more calcium deposit. So it's become a strong bone. But supposing at that time we did not reach to a good bone mass, and that's like your bank balance. Supposing that's the bone mass that you had to reach, that by 60 years, if this is the osteoporotic level, you will gradually come and not become osteoporotic. But imagine you started with a lower bank balance, you're going to use that balance very fast and you become osteoporotic much earlier. So what's the solution? At the moment, prevent fall, make sure if you need, take treatment for osteoporosis, but we need to look into our girls and young kids at home, that they get adequate calcium, they get adequate weight-bearing exercise and playing time to build the strong bones that they need. Last, what's incontinence? There are 2 types of incontinence that trouble women. One is a stress. That means you go for a gym, you're working, coughing, laughing with friends, and a urine leaks. Or your shopping gets interrupted. You just can't hold it. You are looking for the washroom the closest to the shop that you are in. So treatment options are available, both medical and surgical, and strengthening of pelvic floor muscles is just as important as the rest of the muscles that you're looking after when you go to the gym. Kegel's exercise is one of the most common things that we teach, and we want you to do proper repetitions of them multiple times in the day. There are certain yoga asanas also which help you build up the pelvic floor muscles, and urinary urgency is the second one, where, as I said, it gets in whatever you're doing has to be interrupted because you go to run to the bathroom. You can't control. It can be dry, overactive bladder can be dry or wet, depending upon whether you stain your clothes by the time you reach the bladder. It could be because of urinary tract infections, some inflammation, or vaginal infection also, but often it is because of uncontrolled action of the muscle of your bladder. You can do many of these yoga asanas that help improve the pelvic floor tone. And that is why I believe yoga is one of the best exercises that we as Indians do, and of course export to the world as well. The second problem with urine related is I'm passing too much urine. Well, it's a coffee restroom cycle. It's like mathematics. However much water I drink 3 liters in the morning to detoxify myself. And I should produce 3 liters of urine, and you have to go every 10 minutes. Because you must drink only as much as you are required to drink. So drink enough liquid, relax. When you go to pee, please do not strain. If your bladder is giving trouble, cut down on tea, coffee, caffeine, alcohol. Never go to toilet just in case. And that's very common. We're going to the mall, oh, let's just go, like 3 hours we don't have to go there. Or you're getting onto a flight, okay, let's just go, like that's what we do. Know when you should get help. If you leak, feel pain in passing or pass blood, remember you should see a doctor. So take your time to relax the pelvic floor muscles when you are in the bathroom. Go to bathroom every 3 to 4 hours, because that's the time the bladder actually collects about 250-300 ml urine, which is the right time for the sensory nerves to tell you that this is an appropriate time to pass urine. And of course, avoid bladder irritants. And sipping water throughout is not going to help you. You're just going to go to bathroom more. Don't push. Don't hover over the toilet, because that's many women and young girls do, because they don't want to sit on the seat. Don't do Kegels midstream. That's not how Kegel is supposed to be done. And don't pee just in case. These two young women have always inspired me. I think they are just ageless and timeless beauty. But I think it doesn't come naturally. A lot of exercise, diet, and maintaining the right bone BMI helps them a lot to be this. So the people in the audience, you know your height. See if you are in the ideal weight. Many of us, you may be. But remember, the second one is also very important. It's the abdominal circumference. And that less than 80 actually tells, because this is a measure of the intraperitoneal fat that we have inside our tummy. And that's an endocrine organ that creates a lot of hormonal imbalance in women when we do. And this is a problem now. Why? Because these were our mothers and grandmothers, right? This is who we are. This is what we use. Because we have also changed so much lifestyle that kind of exercise which was part of our daily routine is no longer there. But any form of exercise starting at any age benefits everybody. It reduces premature death by 50%. Frequency and duration is more important than intensity. मैं आज 5 किलोमीटर भाग ली और 3 दिन तक नहीं भागी, nullified. Run 1 kilometer every day, but run every day. So that is more important. Frequent, improve aerobic activity. You can choose the exercise that you want, but your exercise to give you benefit must increase your pulse rate. As I normally say, because everybody is working with a phone these days, or with a friend. If you are not able to talk and you're a little breathless, then you're doing the right exercise, okay? And of course, this is the diet. We all know about it, and I think a lot of diet has been spoken about. So I'm going to stop here, and I'll wait for Rashi's myth and, all those questions to come up. There are no questions. Should I ask the audience? And then thank you so much for giving me this time. I really appreciate your time today. Thank you so much. No myths for women's health?
We had some, but I think we're really running.
Sure. Okay, we'll take the questions in the end. Thank you so much. Okay, is there any question? Oh, sure.
Prevent during the menopausal stage, but you have not mentioned any importance to strength training anywhere, which is the flavor of the season.
No, I mentioned in osteoporosis when I was talking, I'm talking about your balance and because you often fall because your muscles don't support you. And so strength training is the most important thing that you need to do at this stage. Not just for lower body, also for the upper body. So that's important, yes.
I was just feeling happy
Yeah,
that okay, consistent नहीं जाएंगे.
No, please जाइए. Also do aerobic where your pulse rate increases. Okay, sure. Yeah, I got it. So that's again very common thing that happens in India, because anytime you are traveling or going to temple, you want to postpone your menstrual cycle. Remember that you are actually trying to change the normal physiology of the body. Once in a while is okay, but it's not a good idea to take it very often, because then the brain is confused, like I'm producing these hormones, she's supposed to have a period, now it's not happening, what's happening? So I think we should not unnecessarily confuse our brains that way.
Hi. What are some misconceptions women have about menopause and hormonal changes?
Who's speaking?
Me. Here.
Oh, sure. Okay. Sorry. Yeah.
Yeah, I'll repeat it. What are some misconceptions women have about menopause and hormonal changes?
Myths. Okay, so the commonest myth is I'm not getting periods, that's why I'm gaining weight. It's the opposite. You're gaining weight and that's why you're not getting your periods. So that's the commonest myth that is there. The other things that people feel is that I'm getting vaginal discharge because I'm weak. Again, a myth. There's nothing to do with your fatigue and discharge. Often people also feel that, I must get period every 28 days like everybody. It's a myth, because everybody's cycle is not the same. I would suggest that, I would say that if you get your period spontaneously on your own, without needing to take any hormones, is a good period, as long as it's not too late or too early.
Thank you so much.
Thank you so much.
Yeah, hi doctor. Yeah.
Oh, yes, sure.
So nowadays there's a new technique which young women are considering of freezing their eggs just to focus more on their career. What's your thought about it?
Okay. This is a good technology, right? There's nothing wrong with it. The reason what you said is not always true. It's not just because they are wanting to focus on their career. We are finding young women with low ovarian reserve. This is surprisingly. We never used to check young women. But today when we check, we find that they have low ovarian reserve. Remember, as women, we are born with finite number of eggs. We don't produce any more eggs in our life. Okay? We are born from some million eggs. Every cycle, a lot of eggs starts recruiting, one ovulates, and all the rest die. Next cycle, the same thing we are doing. We expected that the body will generate so many eggs when we are an embryo or when we are getting born, that it will last a lifetime. When it anyway gets depleted, you get into menopause. But today, that egg depletion is happening at much younger age. When it is happening, say, to a girl of 25 or 26, what do you expect? They are many times not married. Even if they are married, they are still thinking whether they should have a pregnancy. So egg freezing is like an insurance for them. Not everybody, but if we find that the ovarian reserve is low, it may be an insurance for them later. It should not be done just because I want to do it. If the egg reserve is good, you shouldn't. Well, that's a very difficult question because we don't really have clear-cut evidence to say, okay, this result says you definitely have low ovarian reserve and you cannot conceive, which can get proven wrong. So we have not come to a conclusion as a gynecological body that everybody should get checked. But I would suggest that if you are around 30 or your child is around 30 and not yet ready for a conception, may not be a bad idea because we are finding so many young women coming with low reserve. So maybe don't do it on your own, maybe because a larger picture has to be seen. You should see a gynecologist or fertility specialist for that. Thank you. Yes. Come again. I have a question from the panel. This is scary now.
The first question from a male member at least.
Okay.
There has to be diversity.
Okay.
Both of us have the same question. How do you quantify this?
What? The ovarian reserve? Yes, sir. That is very difficult. So we have 2-3 methods to do. We have one anti-Mullerian hormone that we check. So if the anti-Mullerian hormone is very low, but studies have shown that a low anti-Mullerian hormone woman cannot spontaneously conceive is also not there. That's one thing. Then we do antral follicle count on the 2nd or 3rd day of their cycle and check how many follicles are getting generated. So if there's enough number of follicles that are getting generated, the lady still has reserve. But it is still not a completely evidence-based information. But we find that a young couple who is, say, in their early 30s, married for 3 years, they didn't think about pregnancy, they just come to us and the first thing we see and we find a very low AMH. We still guide them to get pregnant spontaneously, but we have to keep it in mind that something may be required. So it's a tough job right now.
Yeah, what you said while answering looked contradictory, Ruma. You said you won't check these girls. At the same time, how do you know somebody has a low reserve?
I got it, sir. See, if we start checking everybody, we'll send a scare. And we cannot really do so much of egg freezing for everybody. That's what I said. So, as gynecologists, we want women to be having their first child by 30. Maybe complete family by 35, also because of egg quality. So if you have now couples or young women who are in their early 30s, have not conceived, maybe they are the ones who should check. I'm still saying maybe. I mean, it's a controversial topic right now. We don't have real answers here.
We don't want controversies in a women-dominated auditorium.
But they are thinking right. It's a women-dominated, they are always thinking forward. So I'm happy they asked that question. All right. I think that's the last question. Then we'll get Dr. Rao. Yeah.
Oh, I think I'll stop there because I think Dr. Subramanian should cover HPV vaccination. You'll cover? Or? No, sir,
Okay, cervical cancer, it's actually Really, a misnomer is not a cervical cancer, it's a vaccine against an infection called HPV, which is the commonest infection associated with cervical cancer. Number 1 point. Number 2 point, HPV infection is a sexually transmitted infection. So the vaccination works best when you are not already infected. So it should be given to young girls. It's a well-established vaccination, there is no problem. It's been used for more than 2-3 decades. So we can give it to our young girls who are not yet sexually active or not married. The controversy arises what to do with women who are already sexually active. I think we'll take that question and then, because that's a little longer explanation, we don't want to delay Dr. Subramanieshwar. Thank you.
Thank you so much, Dr. Sinha, for joining us today. I now invite Dr. Subramanieshwar Rao, Medical Director and Chief Surgical Oncologist of Indo-American Cancer Hospital. He possesses 25 plus years of experience in cancer care and is a strong advocate of equitable access to surgery across India. Thank you so much, Dr. Rao, for being with us today.
I promise it will not be the best of the talks because the three speakers have had excellent PowerPoint presentations. I've always admired all of them, and that includes the speaker who is going to speak after me. Scariest part of the evening, the disease itself scares everybody. So here, the rest of the diseases, you keep talking about treatment and then prevention and various other things. Here, it is something that depresses the whole family. Patients, people who come to us are half dead, emotionally, psychologically, and many times financially. There are not too many things that you can do about cancer. What is said is it truly preventable? While we discuss this, we classify them as modifiable risk factors and non-modifiable risk factors. There are only practically 5 modifiable risk factors. The first and the leader is tobacco, which is an absolute demon. Even in very mild doses, it can actually cause cancer and kill. And it is not useful in any dose. Unlike alcohol, which has a dose disease relationship, and not so good news for the women. The dose for the women, the toxic dose for women, I don't know why, is much lower than men. So men can celebrate with a higher dose of alcohol because the toxicity is much higher in women. Obesity, of course, causes multiple cancers, and that is something that you can fight. Ruma has shown wonderful slides about it. So even if you are not worried about PCOD, you should be worried about cancer, because PCOD decreases your quality of life. Cancer can actually decrease your quantity of life also. So obesity is something that you must fight, because it is directly responsible for multiple cancers. It's not just one cancer. Please don't think it is a cancer of the uterus and the breast, which are because of obesity. There's a list of cancers which are higher in that includes a difficult cancer like pancreatic cancer and various other cancers. Diet and cancer is being talked about. We've heard about microbiome and diet for various other things. One thing that is clear, that directly related, is red meat, which should be avoided on a regular basis. And the other evidence is, we keep talking about diet which reduces cancers. In the truest sense, there is no clear evidence that a particular diet, you can talk about carotenes and then antioxidants, decreasing the chance of a cancer developing in a particular patient. There is absolutely no evidence on a gross scale, because it's practically impossible to produce evidence. You cannot have 100,000 people who take a particular diet and another 100,000 people who are on a particular diet, and then you compare them for about 40 years, 30-40 years, to understand whether this has actually produced cancer or actually prevented cancer. So these are studies that cannot be done because things keep changing. And you cannot come to conclusions because you cannot experiment on people like this. But what is understood is, when you look at the per year consumption of fruits, fresh fruits and vegetables, data is from America because we don't have a handle on the data, how many fruits are produced and how many fruits are actually eaten. So this many tons of fruits, when it increased to 1.5 times, the cancers have significantly reduced in the what is called the SEER database of the country. So one particular relationship is eat fresh, eat local, and eat fruits also apart from vegetables. Eat cooked ones, but not the real roasted ones. So I'll speak about a few misconceptions because cancer is surrounded by myths and misconceptions. Anything that is feared and dreaded will lead to myths and misconceptions, and opinions of everybody becomes very important when you are actually having a major fear of disease and death. Is cancer rapidly on the rise? There are enough patient attendants, patients don't talk about it, who keep telling, sir, there is cancer all over my family, and then I keep hearing about so many cancers that you see much more often than when I was a child. This is not something that is entirely true. I think there is absolutely no need to be truly scared that there is a major rise in the cancer. In statistical terms, there are two terms that are used. One is the incidence and the other is prevalence. Prevalence means in Telangana, for example, at this point in time, the number of cancer patients are counted and that number becomes the prevalence. So many cancer patients are prevalent in this community. Incidence is the number of cancers per 100,000 or 1 lakh in our terms. So here, if the population is more, the incidence the prevalence will always be more. But what is important is incidence, because how many women have breast cancer in rural India, for example. So if there are 8 per 100,000, then if you have 100,000, then you will have 80 of them. So when the population increases, the number of patients automatically increase. When you have a large family, you have many more cancer patients than a person with a smaller family. So, and then the other important reason is aging population. So at independence, you'll be surprised that a woman, the mean survival of a lady in this country was 41 years. That was predominantly because of maternal mortality. Most of them would die because of unattended pregnancies and multiple pregnancies. And then for the male it was around 52. Now both have gone beyond 60 and slowly reaching 70. So when you have a country with aging population, you'll have more cancers. You live till 70 or 80, the chance that you will develop a cancer are very high. So there are elderly people around you. The number is increasing. From 5 it has become 10 and then it will keep on increasing. The number of cancers in America are much more when compared to India, because they have a much more segment of aging population. So this fear that cancer is on the rise, on the real rise, is wrong, and we should not be truly worried. And is cancer fatal? Absolutely not. Most of you understand that if diagnosed early, cancer is a better disease than diabetes and hypertension. Believe me, because diabetes and hypertension actually have no cure. They can only be controlled, and it's a lifelong treatment. Cancer, once you complete your treatment, you only come for a checkup or an evaluation, initially 3 monthly and then 6 monthly, and after 5 years it's yearly. We have patients for the past 30 years back, the patients I have operated are still around, and they are in thousands of numbers. It's not 1, 2, 3. So cancer is just not fatal. If that is so, why such real pessimism? This gentleman was known to die in most of his movies, and they would be silver jubilee hits. Initial movies, when I was a child, he would die of tuberculosis. Later movies, he would die of lung cancer. And in both the movies, he would be coughing blood into the sink, and then the ladies would be crying the whole night, and the next day. That includes my mother, sister, everybody. So such was the involvement. So he would make people cry, and he made lots of money. And what harm this has done to is, they have demonized tuberculosis then and cancer now. So eventually, see, once the doctor tells you have cancer, the audience know that you are going to see him die and then make a huge sacrifice for the heroine, and then all of you are very happy that he has made such a huge sacrifice. So this has created such huge pessimism. And what happens in the society, it doesn't stop with movies. What happens in the society is, there are lots of people who are celebrities, VIPs. When they die of cancer in our hospital, never the hospital's name is written, or never the disease is disclosed. Unfortunately, the doctor's name is also never disclosed, however well you have actually treated them. That is because of the social stigma attached to this disease. He was ailing from a chronic disease. For a long time he was unwell, and then he passed away. Whereas, so the dying patients, sometimes at least after the death, you discuss that he had cancer. But somebody who has survived would never reveal that they have actually conquered cancer. This is changing now. There are enough number of cinema actors and sportsmen who are disclosing and calling themselves conquerors. That is a good sign. So the pessimism has to be killed. It's a good disease. It's not a bad disease at all. It's not bad to have cancer, but as long as it is early. The other reason why there is a scare is, we keep discussing, while I was in MBBS and then MS, I used to be surprised what this 5-year survival means. I should think this surgery, this radiation, chemotherapy, all this is for the sake of living just 5 years. Nobody would ever define what actually 5-year survival within medical schools. 5-year survival actually means. Only later on, only when I went into oncology, I realized 5-year survival means once you survive 5 years, you actually survive forever. That is because any cell which is remaining after these modalities of treatment should sprout and become a plant and a tree within 5 years. If it doesn't happen, which means you have cleared all the cells by these treatments or by your own immunity. So 5-year survival actually means cures, and cure means a normal lifespan wherein you die, but you don't die of cancer, you die of something else. Does biopsy spread cancer? It doesn't do at all. The biopsy is becoming much more important now with so many important things that are coming up with things called immunohistochemistry and next-gen sequencing, which are necessary in personalized treatment for cancer. You don't treat all cancer same cancer in two different individuals can behave differently, like the microbiome, which is different. So you understand the patient and the tumor both, and then match them, and then do what is called personalized treatment, for which biopsy is very, very important. Eating sugar is absolutely okay as far as cancer landscape is concerned. Otherwise, you understand that too much of sugar is not good. Is cancer contagious? Absolutely not. The mother-in-law, daughter-in-law conundrum keeps happening. When the mother-in-law is sick, there is a very genuine, it becomes a genuine reason for the daughter-in-law to keep her out of the house, calling this contagious and being worried about her children, who happen to be the lady's grandchildren also. So absolutely not. Cancer has never spread to anybody else because it cannot survive even if it is injected into you. That's how your immunity is. If it was contagious, I would have developed 100 cancers already. Herbal remedies, maybe they are called unproven methods of cancer treatment. There are lots of medicines which have come from herbs. Lots of chemotherapy drugs have come from herbs. But there is no definite proof that they will definitely do good to a particular patient. So use it when you could always use it to instill confidence in the patient when our treatments exhaust, and that happens not very rarely. Is cancer treatment toxic? Yes, it can be toxic, but it can be controlled. And the major worry that the women keep telling us is, after we operate, they are very happy with the operation, a little bit of pain. As soon as you say chemotherapy, they are extremely worried because it is in multiple cycles. And the major worry is hair loss. Hair loss is a major worry because it is then that the society understands that you might be having cancer. So what I do then, it is important and it can affect every component of your life. What I do is I take out my cap. I'm actually much balder than G.V. Rao. He showed a photograph 10 years back. So I take out my cap and tell I'm permanently bald. You will only be temporarily bald. While I was preparing this slide, I used AI to see how I would look. Suddenly I thought I look much better. Does it run in families? Very small percentage. Don't be too worried. If we have similar cancers, somebody says my father had a brain tumor and my uncle had a colonic cancer. It doesn't work like that. Similar cancers or same cancers in more than 2 first-degree relatives or 3 second-degree relatives, then you need to be a little worried. Common cancers which are related are endometrium, breast, ovarian cancers. Vaccination is important. It's a vaccine against a virus, which is a very slow-growing virus. Ruma has talked about it. 9 to 14 is the best time. And if you're vaccinating 9 to 14, you need only 2 doses. That is the incentive. Beyond 14 up to 25 is all right. You need 3 doses. After that, people keep talking about it. If you have not actually, the virus has not colonized, it could be useful even up to 45. But I think it's good to vaccinate all your children. I have vaccinated both my daughters. So please do it. Please don't be worried about the adverse effects of vaccine because this can prevent 95% of cervical cancers. There is no other vaccine, no other preventive measure which is as effective as a HPV vaccination. Please do it for your children. Thank you very much. Done?
Thank you, sir. Early detection is very important, is what everyone says. And what's that one lifestyle or screening practice every woman should adopt to detect cancer early? Because
2 cancers. In women, there are 2 cancers which can be screened. To be screenable itself is a phenomenon. There are only practically 4 cancers which can be screened effectively. 2 in men and 2 in women. One is breast cancer. Start doing mammograms at 40 if you have no other risk. If you have a family risk, you must start much earlier. And cervical smears from 35 onwards for women. Prostate and lung in smokers and men at a much later date. Yes.
And we hear some blood tests are coming up to test. Do we have something like that that's already there?
It's on the bench side right now. There's something called circulating DNA. It has not reached a stage wherein you can diagnose with certainty because these tests, if they are false positive, it becomes a serious problem. So they undergo rigorous trials and tests before they come into the market.
Yeah, we hear about this BRCA test. And,
Correct.
Can anything else that you would like to talk
Yeah, people with family history, for example, 2 first-degree relatives. First degree means mother, maternal aunt, sister, and people like that, or 3 second-degree relatives. You need to do this test, but before you get this test done, you must be ready to make some difficult decisions. See, it's not good to do it before 25 or before completing the family. That is one aspect. You have to be alert, all right. So once you do it, there are things called risk reduction surgeries. See, if you have BRCA positive, for example, the most difficult cancer is ovarian cancer. and there is something called BRCA1 and BRCA2. So if you are carrying this mutation, there can be multiple exons in this mutation. The risk differs according to the report. You will get a 20-page report, 20-page report. So you assess the risk, and then if you have completed your family, the best is to undergo bilateral ovaries removal, both sides, ovaries removal, because it's very difficult to diagnose ovarian cancer early, practically impossible. Even if you undergo a scan every month, you will have an ovarian cancer at stage 3, because the scan is insensitive to early spread. So breast bilateral mastectomy is also necessary, just the way Angelina Jolie has undergone, because she had a very high risk. She belongs to a community called Ashkenazi Jews. Within the Jewish community, there is a group called Ashkenazi Jews who are the richest, most intelligent, most beautiful, but have breast cancer also. So she belongs to that high risk group, and her mother had breast cancer at a very advanced stage. So she underwent both sides mastectomy. This reduces the risk by 98%, because even if you remove both the breasts, there is some breast tissue that is remaining. Still, they can develop breast cancer. So you need to be alert even then. But most of the risk is eliminated. Yes.
Good evening, doctor. Can homeopathy or Ayurvedic medicine cure cancer?
See, now there is a chapter when I teach students on a regular basis. In the main book considered as Bible of cancer, the chapter is named Unproven Methods of Cancer Treatment. You don't call it unethical, unscientific. They have no proof that, see, in a particular dose, if you give this many leaves of this plant, this cancer will respond this much. So this evidence is not there. However, I have seen, honestly, I have seen patients respond to these treatments after completion of all modalities of treatment, but it is anecdotal. Was it that particular medicine, or is it patient's immunity which has turned the tables on the disease? We don't know. Because spontaneous remissions are known without any treatment also. There are enough experiences while I was in the government cancer hospital and now, because of these patients are so poor, they cannot even travel. You advise some treatment, and then they come back after 4 years without any treatment. It was a stage 4 cancer, proven cancer, and we review the slides, it was cancer always. They would take 1 cycle of chemotherapy of a schedule of 6 cycles, and they are absolutely free of disease. So this is something that would actually should be understood as patient's immunity that has suddenly woken up and tackled the disease. But how can you be hopeful of such a thing happening when it could not stop it from coming in? See, because your immunity dropped, the cancer has sprouted and grown into a significant size. So how do you suddenly realize that the body will join forces and then kill this disease? So we don't have enough hope that will happen. So miracles do happen, and miracles can happen just because your body can come back and fight.
Yeah, at least patients who can't afford to go for this treatment, there's no harm in trying.
Affordability should not be a problem. We treat everybody even if they don't have money. So it's not affordability. Because see, 55% of our patients in the hospital do not pay us a pie. So that is the greatness of that institute.
But I heard that bone marrow test and all.
Bone marrow transplant is a very expensive thing. And when it costs 50-60 lakhs outside, it costs 25 lakhs in our place. Because there is so much of expenditure. Otherwise what happens is they'll bite into the rest of the hospital, and hospital, so survival itself will become difficult. And the overall results are also, there is an element of mortality there. So we have to prioritize, because we don't have unlimited resources. We don't have unlimited resources.
Good evening, doctor.
Yeah.
This question is regarding HPV vaccine. 10-12 years back only Gardasil was there.
Correct.
Then if the patient has taken plain Gardasil, which covers only few strains, now she is unmarried and not exposed to sexual this thing, should she take again Gardasil 9 again one more course?
Nobody actually knows the answer, but it's not necessary. It's not necessary because there are 2 strains which cause 95% of cancers, and they were included in both the Gardasil and Cervarix both. So the bivalent one also is very good actually, because HPV 16 and 18 cause cancers. All others cause warts. You keep talking about warts on the skin. Similarly, the genital warts are caused by these diseases. There are more than 100 HPV subtypes causing different types of diseases. We don't vaccinate against them. HPV 1 produces plantar warts between your fingers, between your toes.
Sir, I'm a dermatologist.
Yeah.
I'm Dr. Shah.
Yeah.
So, usually, can I advise the patients to take Gardasil 9 if they have already taken Cervarix to prevent warts?
Yeah.
Yeah, thank you.
Mike Ruma.
16 and 18 are covered. The easiest way to catch cervical cancer early is a pap smear.
Correct.
It is the most simple test. And what we detect in pap smear as precancerous takes
7 to 8 years to turn into cancer. So I think we will really miss the bus if we haven't taken care of that. So instead of getting too much ago about HPV vaccination, all women should get pap smear. There is no question.
Yeah, those who are not being vaccinated, because it's a rare disease now. Luckily, what has happened is, if you looked at the Indian data, cervical cancer was number 1 for a very long time. Now it's breast cancer. Cervical cancer has considerably gone down because of the improvement in quality of life indices. Endometrial cancer has gone up because you are living longer and you are becoming fatter. Both of them can be diagnosed very early. Yes, correct. HPV test or even a pap smear can diagnose early, and this disease actually becomes invasive only after 10 to 15 years. That is the reason screening is very effective. So if it starts today, only 15 years later it actually becomes a cancer. So there is a lot of time.
Good evening, sir. Sir, CA 125 test should be a part of our annual checkup.
Absolutely
If the mother has ovarian cancer.
Yes.
Then it should be a part of the yearly.
Not CA 125 alone, but you need a scan also. Both these give you some chance, but they are not everything. They are not everything. Yes. Ovarian cancer cannot be screened easily. Yeah.
Thank you, sir.
I think we're running a little short on time. We still have. Okay.
What I have heard is that paternal side of the family, for a woman, if my paternal side of the family has traits of breast cancer from my grandmother to my paternal aunts, so am I on high risk or not? Because my maternal side is clean, there is no cancer history.
Either way, the risk is.
Then, in that case, should I, as a potential, I don't like to call myself at risk.
No.
Should we do a BRCA1 or a BRCA2 or both?
No, it's always 1 and 2. You cannot choose between the two.
So we have to do it together?
Yeah, it's a test that is done together. There are 2 genes, so they are done together. They are not separated. And irrespective, it costs the same. So nobody splits it and sees.
Thank you.
Thank you so much, Dr. Rao, for all your time and clarifying all our doubts. Last but not the least, I call upon Dr. Srinivas Kishore to speak to us. Thank you for your patience. He's a distinguished ENT and head and neck surgeon and a sleep specialist. He possesses decades of clinical leadership and is director and head of ENT at AIG. Thank you, Dr. Kishore, for speaking on the very important topic of sleep hygiene today.
Good evening, Flo. How are you guys doing? So after everything comes sleep, right? But it's not, this is something that is going to be an answer for all the talks that we've heard before. Okay? So if you can actually get this and master this, you probably will not need all those. So with that, let's start. Now, when I look at this group, I see all of you. You are trailblazers, you are leaders, you are entrepreneurs, you are caregivers, you are change makers, right? And we celebrate your hustle. But we're celebrating your hustle at the cost of what? At the cost of your sleep. And all of us know that, right? All of us know and understand this. So today, let's talk about the silent driver that actually would fuel your success. So I won't take too much of your time. In the next 10 minutes, we're going to discuss the importance of sleep, in how it matters to you, both from a wellness standpoint and also disease prevention standpoint. So let's jump in. So, to understand sleep in women, it's very different from it is for men. And for us to understand that, I would like to take you through this very short journey of sleep in women while they grow up. As they're newborns, that's the best stage in their life, you know. Sleep is there, but sleep is fragmented. There's no difference between whether it's a boy or a girl, they're all the same. But once they become pregnant, and then they have menopause, and then there is aging. There are three silos in a woman's life. Now what you don't see here is a big box, which is the reproductive years, which I will talk to you a little later, because that is something which is completely different. So what happens during pregnancy is obviously, some of you have gone through it, all of you have gone through it. There is obviously a lot of poor sleep. Now, why is there poor sleep? Not only because of mechanical problems in terms of difficulty in breathing. What also happens is that there is a lot of edema in the feet, right? Once there is pedal edema, what happens if you lie down is all that pedal edema would actually come up into the upper part of the airway. So, there is edema around your airway, which is reducing the cross-sectional area that is available for you to breathe. So what happens? It becomes more difficult for you to breathe through the upper airway. And then what also happens is, because the progesterone is pumping, all the secretions in the nose gets clogged up. So it becomes difficult for you to breathe through the nose. And that's called pregnancy rhinitis, right? So this is something that all of you have experienced, right? So what happens here is that you're not able to breathe through your nose, you're not able to breathe through your mouth, and it's difficult to breathe through your diaphragm because your diaphragm has been tented up. And all the edema from the feet is traveling up into the upper airway. Hence, it becomes very difficult to breathe. And one would develop something called as obstructive sleep apnea, especially in the third trimester, right? But fortunately, it's very short-lived. Now, why is that important? It is important because if you have obstructive sleep apnea, that means difficulty to breathe during your sleep, it is associated with gestational diabetes and preeclampsia. So this is an independent risk factor that needs to be talked about. Of course, this is not the platform for that, but I just want to sensitize you. What happens in menopause? Women have two wonderful hormones, estrogen, progesterone, which are awesome, right? They protect you against one of the biggest conditions, but once the plug is pulled, the common things that come are, of course, again, poor sleep. Why? Because estrogen gives good sleep. There are a lot of explanations for that, but take it that way. Number two, the commonest disorder for all of us is insomnia. Number three is a condition called restless leg syndrome. Have any one of you heard of this word before? There you go, there you go. Restless leg syndrome is something that could actually make your partner go and sleep in another room. In fact, it is so violent sometimes that people just get up, keep pacing throughout the night, so that just walking like that throughout the night can make you feel better. And you know, one of the commonest causes for restless leg syndrome is iron, ferritin deficiency. And most of us don't even pay attention to that. We are on our vitamin Ds and B12s, completely forgetting about what is also very important, which is iron. And of course, there is sleep fragmentation. Sleep fragmentation basically involves, one, because of our inability to breathe, we may be getting up. We may be getting up just because we don't have the hormones to let us sleep and have a continuous sleep. And last but not the least, the aging type, wherein the last two things come in, cognitive decline and Alzheimer's disease. Now, why is there Alzheimer's disease there? It's very important to know that if somebody has obstructive sleep apnea, there is something called as the glymphatic system in the brain, right? Like how your lymphatic system cleanses your body, the glymphatic system in the night cleanses your brain. If the glymphatic system has to work, you need to get good stages of slow wave sleep, right? How many of you have heard of slow wave sleep? I'm sure all of you have heard of slow wave sleep. Yes, you have. So, if you have good slow wave sleep, then the glymphatic system works beautifully, clearing the brain of what is called as beta carotene and tau proteins. These two proteins, once they get deposited in the blood vessels in the brain, that is the foundation or the precursor for Alzheimer's. So if you want to preserve your brain and not get Alzheimer's, what should you do? Sleep well, right? Now, let's jump into and pay a little few words, let's talk a little bit about what happens in the reproductive years. Now, this is very important. Why is it so important? Because in every phase, there are changes that happens. It is such an orchestra, I would like to call it an orchestra, where each phase has a particular kind of instrument that is playing, and it has repercussions on your sleep. For example, in the menstrual phase, just pain can cause sleep disruption, just pain. But in the proliferative phase, the REM sleep latency, that means sleep is basically two kinds, right? Dream and non-dream sleep, right? Let's just divide it into that. In dream sleep, one has mental restoration as opposed to physical restoration that happens during non-dream sleep. So if you were to sleep well, you need to not only get the dream sleep at the right time, at the right amount of time. Then only your body and your brain will be cleansed. And also you will be having memories that are restored. If not, they will just pass. And then in the secretory phase, there is again reduction in REM sleep. That means again your memory is going to be played on. And there is again sleep efficiency. Now all of this is happening when again this orchestra of hormones are again playing their beautiful role. While all this is happening below, for you there is the invisible burden, which is the mental load, right? This is happening below, but up there in the upper story, what's happening? You're juggling between your professional lives and your domestic responsibilities, which is a huge thing. Also, and I'm sure all of you do this because most of you I know, and you have this mental to-do list which is constantly going on in your brain. because you're at all the time you're keeping this, okay, I have to do this, and this. Now, when all of that is happening, you obviously cannot shut it off. Even when you are lying down, especially, what also happens is, throughout the day, right, you're always in reception mode, right? You're receiving your reception mode. But are you introspecting? When you are in bed, that is what you're doing. So the brain goes in that direction. Okay, this happened this morning, this happened. So you obviously cannot shut off that brain. And when I use the term on call, I'm not talking about the doctors amongst us. I'm talking about every one of you. Because as a caregiver, to whether it's your kids or your in-laws or your parents, you're always on call. Because we don't answer our phones. Because you're always there. And this is a evolutionary thing, you know. Because women, if you see, they are lighter sleepers. Why? Because even when you were hunter-gatherers in the jungle in Africa, if there is a wild animal that's coming in, if you have to protect your progeny, you have to be a light sleeper. You can't sleep off like the Stone-Aged man, you know. Some wolf or hyena would come and pick you up away. So this is an evolutionary thing. This is continued. And that's why, even if there is a slight sound, like a partner snoring, you can't sleep, right? And that takes a toll on you. So these three things add to the mental load. So here are some fun facts for you. Now, 1 in 4 women and 1 in 5 men have insomnia, right? This is the commonest sleep problem. As many as 50 to 30% of males and 10 to 30% in women have obstructive sleep apnea. This is number 1 and number 2 common sleep problems, right? Now, why is there 30%? Because as long as you are pre-menopause, you're protected by estrogen and progesterone. These are wonder hormones as far as sleep and sleep apnea are concerned. But once they go, then the prevalence is the same. Now, if you really see, 60% of people don't seek help for their sleep problems because we do not know that all of these problems are probably somewhere directly or indirectly related to sleep. And 8% of adults use prescription for medication for sleep, right? So there's a huge gap and vacuum there. Here's another fun fact. The bigger you are in the organization, the less sleep that you're getting. So if you're a CEO, you're getting the least sleep as opposed to an average Joe in your organization. The bigger post you are, the lesser sleep that you're getting, right? So definitely there is something there, and this is something that you should know. Once you're awake 24 hours, that's equal to 4 glasses of wine. The feeling is the same unless you go to sleep, right? That's the feeling. And if you see, most of these disasters that have happened, they are also directly or indirectly related to poor sleep, right? So if there is so much out there, why is it that all of us sitting here we know so much less about this? Now, all of this deprivation can cause a lot of things, but you can actually take it down and put this in these 4 headings. Number 1, productivity, right? You are obviously don't sleep well for 2 days. You know that it affects your focus and decision making. All of you make huge decisions, right? People depend on it. That decision making will be affected. 2, there is mental health issues and physical health issues. Now, even if you treat depression, right? If somebody has depression, even if the depression is cured, the ability to sleep still doesn't get better. And there's a very clear positive relationship there. The physical health, things like effects on the heart, uncontrolled hypertension, arrhythmia, so on and so forth, diabetes. And there is obviously sleep and eating disorders. And I'm sure you know that the less you sleep, the more you will eat. Because once you don't sleep, and if you don't breathe properly, there are two hormones in the body, the ghrelin and leptin, right? Ghrelin is a hormone that says you eat, you are not satiated. Whereas leptin is a hormone that says you've had enough, don't eat anymore. But if your sleep is fragmented and your breathing is not proper, leptin goes down, ghrelin goes up. So obviously you're not sleeping and your craving for sugars increases because you want instant gratification. That can only come from sugars. And last but not the least, resilience. This is the most important, and this is what defines all of you. Your reduced ability to manage stress and setbacks, right? That is what it is. That is what it is to be a woman, to come up and whatever setbacks come, and I see that in my family, right? But if sleep isn't proper, that can get affected. So what are the most common sleep disorders in women? 3 things: insomnia, sleep apnea, restless leg syndrome. Each one of them are a conference by itself. But it's important that we know these things. And unfortunately, they are not independent silos. They can happen together. And that's what makes it a little more murky to manage. So, we want this to be that. So for zero cost, you can go from this to that by just unlocking your secret weapon, which is sleep. But again, that's the biggest question, isn't it? How to get good sleep itself is a big challenge. So these are some small points that I put in. Like, for example, in order to get good sleep, you need to get 30 to 60 minutes of good sunlight. Right? When you wake up in the morning, try to let the sunlight get into your eyes, because it directly affects the pineal gland, which releases melatonin. Wake and sleep at consistent times. Now, there are also important. It has been shown that if you have less than 6 hours of sleep, it can have multiple repercussions. R is regularity. That means you need to develop that discipline to sleep and wake up at the same time. That is regularity. And T is timing. It's timing that is also very important. What is timing? You need to know what is called as your chronotype. Every person is not the same. What is a chronotype? You may be a night owl, you may be an early morning person, or you may be an evening person. If you are a night owl, if I make you sleep at 9 p.m., you will be a zombie on the bed. You are not. So it's very easy to know the chronotype. There are lots of internet questionnaires that are available to give you your chronotype. So it's very important to know your chronotype to see whether you are a night owl or a morning lark or you are a normal person. Right? It's important for us to know that. So what is it? QQRT. Okay? Then if you have very bright lights in your room, please try to reduce it. Limit your naps. When you're so exhausted you feel like taking a nap, but don't let it cross 90 minutes at all if you have to. If awake, try NSDR. It's called non-sleep deep rest, also called as Yog Nidra. Okay? Which helps me. I'm sure it can help you as well. And keep your bedroom cool and dark, because for you to go to sleep, your bedroom should be at least 1 to 2 degrees lower than the environment. So when you wake up in the morning, it needs to be a little warmer. There are very good mattresses that have come with AI and all that, which can do that, but we don't have them in India as yet, but we'll probably get it. And another very bad thing is to have alcohol to sleep. There is a difference between going to sleep and passing out. Alcohol causes passing out. It does not cause sleep. The architecture of sleep is completely different when you have alcohol. And to have alcohol to go to, most of our patients, I have a couple of pegs to go to sleep. That's the most absurd thing, right? It does not. There are lots of problems to it. So avoid alcohol and stop kidding yourself that it's a sleep medicine. So, dear friends, prioritize sleep not just for yourself and for your family, but for your organization as well. So start today, commit to one change for better sleep from next week onwards, because this week is Diwali week and I know it's going to be late nights. So next week onwards. So thank you very much for your patience here.
Thank you so much, Dr. Kishore, for the wonderful presentation on sleep. Any questions from the audience?
Medication on a daily basis.
Right.
For a patient
So,
who's 80 years old.
There is a pyramid that you need to climb to get there. Restil is not a sleep medicine. It is an anti-anxiety medicine. So, if anxiety is the cause, then there are other ways to reduce anxiety that can cause sleep. So, that used to be something long time ago that people, but there are newer drugs that can work on your sleep now. And it's important that you first follow sleep hygiene, what is called as sleep hygiene. Try to bore yourself out with stuff. Try to reduce blue light in your life towards evening. Try to take a shower. Try to read some nice boring things. Then go to sleep. Please, please think that your bed is only for sleep. Do not do other things like, watching TV or reading or watching your iPad on the bed. Once you're knocked out is when you go to the bed and sleep. So my answer to your question is no.
So this is for my dad actually.
So there are other medicines, because what Restil does is it depresses the respiratory center as well. So for an elderly gentleman, if his respiratory center is being depressed, his breathing is not up to the mark. So there are newer drugs that can actually work on sleep itself. But if somebody has got used to it, and what also happens is any drug, the body gets used to and the dosage keeps increasing. So, thank you. Yeah.
Sir, as you have mentioned that there should be minimum hours of sleep, like 6 to 7 hours. We all know you doctors get really low amount of sleep because of schedule. So how do you people cope up with that, so that can you give some advice on that?
Yeah, sure. I think you hit the nail. You took it bull by the horns, as you like to call it. Yeah. So I'm sure everybody can sort of contribute. But for me, I take naps. I take naps between surgeries. So as the first case is over, and between the second surgery, as it's getting prepped up.
Not during surgery.
No, thankfully no. So NSDR has worked for me. I'm sure it will work for a lot of people. It's really good.
That NSDR is exactly.
It works, right? Yes, there you go.
NSDR really works. It's as good as sleep, is it?
Yes. There's a lot of evidence to show that.
And I just heard you wrote the mental to-do list that come up in the night. Then what do you do to get out of it? NSDR only?
No. So sleep hygiene is where it is important. So basically, what you can do is you will sit down and make a list of those things. Actually make a list of those things. And you really see how many, and what also happens is the things that are there that didn't bother you during the morning, right? They bother you in the night. And sometimes you wake up in the middle of the night and start ruminating on those things that actually don't matter. Because if you really think about this the next day morning, say, why did I even bother about this last night? But it can actually have a toll on your thing. So make a list of what they are, and then and there, try to find solutions for it. All right? And that way, at least your brain is at rest to do whatever, and then you can sleep well.
Okay, thank you, sir. Because I think I have very big lists that come up middle of the night. I think my team knows that.
We know.
Sleep, that has to do with the post. We all have gone through that. We remember and we keep...
Our committee group is flooded in the morning at 6 a.m. and then it's quiet throughout the day.
Committee is transitional. They keep moving, so they are aware of the syndrome of the chairperson post. Dr. Kishore, I've never discussed this with you, but because of this topic in this presentation, is there actually a disorder of excessive and very, very sound sleep, which I think I have?
That's what you think you have.
Yeah.
Yeah. So there is, what do you mean? You sleep?
I mean that the moment my head hits the pillow, I'm gone, and I sleep like that Stone Age person. So anything can happen in the house, I can't wake up.
Good for you.
Are you sure?
You can do a robbery in a house.
Yeah, absolutely. Now that you made it open. But the fact of the matter is that how do you feel when you wake up in the morning? You feel good, energized? Then that's perfect. Nothing like it.
So my body needs about 8 to 10 hours of sleep.
Yes, because they don't have every person it's different. Right? For example, a baby needs like 20 hours of sleep. If you've seen a baby, all they do is cry, sleep and poop. Nothing else. And eat. So that's all they do. So as you grow older, that amazing ability to hit that golden spot. So if you would have taken your child to a movie when they were a kid, they could, no matter which Dolby Digital it is, they would still sleep. Try taking them now.
Yeah, so I can sleep like that. I can be in a power like this.
So I think we have to take your brain and do something about it.
Good evening, doctor. My issue is just the opposite of hers. No matter how tired and with all most of the conditions met that you've prescribed to sleep well, I still find difficulty in sleeping. Though I go to bed like around 10:30, I still have a problem to go into deep sleep until 2.5 hours later than that. My mind is constantly racing. So
you are normal. Okay, let me start by saying that. You are normal, right? So what is very important to really look at is that, first of all, are we doing everything in the sleep hygiene part, right? And also what you can do is, there is a 2-week, what we call as a sleep diary. You can just download it or I can give it to you. Just try to fill that sleep diary. That will actually give you where we are faltering, right? And based on that sleep diary, we can necessarily do and pick up the points where we can work on to improve. The last should be medication. Medication should be the last thing.
I wouldn't anyway take.
Yeah.
I just wanted to know why.
Because they are low-lying fruit, right? You want to pick it up. But what happens is, you're actually messing up with the natural harmony of things, which you probably will have to depend on. If after there may be many reasons why you're not able to sleep. Because getting sleep is like landing a plane. You know, you can't just switch off the engines. That will become an Air India. So it will crash. So you will have to land it. So in order to land it, there are so many checklists that a pilot does to land it, right? So that's what we need to do, so that something will be there. And if there is nothing else, of course there are some medications that you can do, but all is before.
Anyway, Srinivas.
Sir.
I think.
One last question from Dr. Rao.
I always thought sleep is truly not understood.
Yeah.
Is it not? You have spoken so well and in such detail. See, you call it something a power nap, is it not? 10 minutes while you are sitting. Generally, when, sleep by definition is when you are lying down actually. You are just sitting there and then you feel so energized.
So energetic.
So
Absolutely.
much more energized than your 6 or 8 hours sleep. So this is no REM, no NREM in all this. So it's not truly completely, you have not unraveled the physiology of sleep as yet. But within limitations, this. So, and let me tell you, Srinivas, I have not slept more than 4.5 hours in the past 44 years.
Wow.
44 years. In 1979, not on my birthday, not on any other day. I cannot sleep more than 4 hours. I'll wake up, that's all. And I'm 62 now and I think I'm good.
Yes, sir, absolutely.
So it's not understood.
But I don't think that should be the message that goes out.
One question. How reliable are the sleep trackers and compared to the clinical diagnosis for sleep apnea?
So there are a lot of sleep trackers right now, but they're all surrogate measures. So there is good and bad to this as well. The good thing is it will help you to sort of organize your sleep. But if you're one of those anxious people and you're constantly looking at your device and you're now worried that you didn't get enough slow wave sleep or you didn't get your light sleep is so much and you're obsessing on that, then you will not fall asleep because of that obsession. So that will come and bite you from here.
Thank you so much, Dr. Kishore, for the wonderful presentation. I would like to invite Chairperson Pratibha Kunda to please felicitate Dr. Rao. We missed him earlier. I would now invite Treasurer Shilpa Raju to please give the vote of thanks.
So, thank you. On behalf of Flow Hyderabad, I extend my heartfelt gratitude to our keynote speaker, Dr. D. Nageshwar Reddy Garu, for your remarkable talk on the power of gut microbiome. And your insights have reminded us that truly wellness begins from within, especially the gut. A warm thank you to Dr. Ruma Sinha, Dr. Subramanyeswar Rao, Dr. Srinivas Kishore, and Dr. J.V. Rao for sharing your expertise in your fields. Your talks on women health, cancer awareness, sleep wellness, and role of AI in healthcare have broadened our understanding and sparked meaningful conversations that will stay with us. Our heartfelt appreciation goes to our sponsors for standing by us so generously. Our premium platinum sponsor, Swastik Spices, diamond sponsor, BTech CAD, gold sponsor, Southern Travels, and initiative sponsor, Vision Tech. Special thanks to AIG Hospitals for opening your doors to us and providing such a wonderful venue for our conclave today. To our past chairpersons and members, your unwavering encouragement continues to guide and strengthen every Flow initiative. To our incredible events team, thank you for making our health conclave a seamless success. And to all our wonderful audience, thank you for your presence and enthusiasm. And let's carry forward the insights from today to build a better, healthier, and more mindful lives. Please join us for high tea. Thank you very much.